Okay. Oh, I'm happy to be here and certainly would like to thank the C.L. Davis Foundation and the AFIP for making this opportunity available. I think we'll go ahead and get right on into the slides. So we'll start. We're going to be discussing diseases of inland mammals and birds. And I will say that right now the emphasis is going to be on free-ranging mammals and birds, so that will be the emphasis of this talk. Let's go. Okay, just as an introduction, I'm going to start off with why in the world are we interested in studying diseases of wild animals. First off, I have disease effects on populations. And as you may know, there can occasionally be large epizootics or large epernitics, which can have direct influence on populations of wild animals. But frequently, while there may be a large number of mortalities, in fact, if we look at population dynamics, these disease outbreaks may not actually have limiting effects on populations. Frequently, the diseases that do have the most significant effects are exotic diseases that are brought in to naive populations of animals. And probably the best example of that would be the introduction of rinderpest into Africa that had devastating effects on the wild ruminants in on that continent. Large mortality events certainly are of interest to the public, even if there are no lasting effects on the populations, and we all know of the public interest in such outbreaks as large outbreaks of avian cholera, the Canine Distemper outbreaks. These kinds of things obviously catch the news and catch the interest of the public, and so we want to be able to give information to the public as to what might be going on here. Of course, disease can have significant effects on small populations. So if we look at endangered species, these animals with their small populations can be quite seriously impacted by disease outbreaks that normally under situations of large numbers of animals in the population, the effects would be minimal. And then we also need to think about subclinical effects, because frequently we think of piles of dead animals, and in fact, much more frequently we have infectious agents and toxic agents, for example, having subclinical effects that perhaps may be synergistic and add up to more significant problems. And a lot of these we're just learning about. Of course, there are public health concerns, and some very significant diseases of humans are reservoired in free-ranging populations, and obviously things that come to mind are rabies and sylvatic plague, which I'll talk considerably more about. Diseases of wild and domestic animals and the interaction between these groups of animals certainly is of concern to managers of both wildlife and of managers of domestic animals. And so diseases such as brucellosis in wildlife can be a very significant problem, and wild animals do serve as a reservoir for this disease, and obviously has an impact on the eradication program for that particular disease. We have to recognize it's a two-way street, that diseases do go back and forth between domestic animals and wildlife, where we have overlap between the species and appropriate kinds of susceptibilities. We get questions from the public that need to be answered. People want to know, can my dog catch this disease from a deer? Can my cow abort because of running in the same pasture with antelope? We need to be able to help the public answer these kinds of questions. And then, of course, diseases in wildlife can be important models for looking at human infectious diseases or other types of diseases. One that specifically comes to mind is learning about host viral interactions with the introduction of myxomatosis into wild rabbit populations in Australia, and the benefit that came out of studying those kinds of interactions. So there's a lot to be learned by studying diseases of wild mammals and birds. I'm going to talk, obviously I can't cover all wildlife diseases in this talk, and so what I've done is gone through and selected diseases that I thought were important, and obviously there's some biases here, my own biases. They're obviously going to be on inland birds and mammals. I live in Wyoming and work in Wyoming, and we don't have very much coastline out there, so I'm going to be concentrating on the things that I see and the things that I think are important. I'll be focusing primarily on free-ranging species. I do want to say that the emphasis will probably be on western United States. I won't try to cover international aspects of wildlife diseases, and there are obviously some very important diseases elsewhere in the world that I obviously am not going to talk about. I don't have personal experience in those areas. Definitely want to give credit to a whole variety of different people that have contributed slides to me over the years. I'm not going to individually name them because there's slides from many different people, and I think that's one of the really nice things in our field is that we can feel free to exchange our information, and that includes slides to be used in it for educational purposes. And so these slides are from a number of different sources as well as my own. And as I mentioned, there are some biases inherent in the things that I'm going to be showing you. Certain things come into regional diagnostic laboratories, and obviously that biases the things that I see at the laboratory and things that I'm able to talk to you about. I'm going to start off going through a variety of different diseases, but I'm going to start off with starvation and malnutrition, and many people, and I see this in the wildlife management students that I teach, don't think of this as a disease, but in fact it's probably the most significant disease, if you will, of free-ranging wildlife that we see, at least in the western United States. And we have animals dying of starvation and malnutrition every year, and when we have bad winters that can have very significant impacts on populations, and this is a situation that certainly can limit populations of free-ranging wildlife. So I want to start here, and then we'll move on into infectious diseases and then some other diseases. First of all, as I mentioned, we do have outbreaks, if you will, of starvation, and obviously it's very significantly impacted by habitat conditions and by weather conditions, and also the population dynamics of the species at the time. These are mule deer that are starving to death, and you might not think that looking at it from the distance that you're at there, but the animals have a hair coat that kind of stands up, and we see that the prominences, the bony prominences, are quite obvious. This is probably going on into into the latter part of spring. There's been a lot of snow cover. These animals seek out micro habitats where they get a little bit of protection from the elements, and if we were able to zoom in on the forage in that area, we'd see that there was basically nothing left for these animals to eat. Again, an example of a deer that's in very, very poor body condition. The hair coat's fluffed up, prominence of the bones. The junction here between the neck and the body is very prominent, and that suggests muscle wasting. And again, the hips are fairly prominent. So this is an animal that's in trouble. It may make it through the winter if bad conditions don't continue, but it's an animal that's having problems. This is frequently what we see is animals that have sought out particular areas of shelter, and we find a number of carcasses in this area. Generally, it tends to be the young animals and the older animals. These are animals that don't have adequate fat stores going into the winter. And then if you, besides finding these number of dead carcasses in this kind of protected area, if we look at the utilization of the forage in these areas, these animals have been eating very large pieces of twigs and really getting essentially no nutrition from the material that they're eating. These animals, when they're starving, of course, they try to fill their rumens under any circumstances, and so they will have material in their rumens. It's not like the rumens are going to be empty, but the material that they eat is not adequate to maintain them. And this is an elk calf that's in the process of dying. Also very poor body condition, the hair coat raised and sticking up. You can see the face kind of has a fuzzy look. Ears are down, and the animal's not paying very much attention to you. And this is an animal dying of starvation. As I mentioned, it probably takes more animals than any of our infectious diseases in the western United States, and this happens to be an elk that died out on the National Elk Refuge. And the coyotes then benefit, the scavengers and predators benefit from that opportunity and make use of the carcasses. Grizzly bears make use of the carcasses. The lesions of starvation are pretty much the same as you would expect in domestic animals. This is an animal that has died, and we've skinned the animal back, and as you can see, essentially a total absence of subcutaneous fat, muscle atrophy along the back and over the thighs, and you can see the prominence of the scapula here. Very poor body condition. And if we look inside the animal, again, if you look in the mesentery here, there's complete utilization of the mesenteric fat, no fat around the heart. And if we take the individual organs out, of course, serous atrophy of fat is very prominent, and you can see that there's the gelatinous atrophic fat in the cardiac groove. Sometimes you will see some increased amount of yellowish straw-colored fluid in the pericardial sac. Sometimes you don't. again, complete loss of fat from the omentum and the mesentery as well around the kidneys, and kidneys are a good place to look for fat. Traditionally in wildlife management, there are various ways to assess the body condition of animals, but and there are a number of different scales that are used. Frequently there's a ratio of kidney weight to kidney fat weight, so there are various ratios that are used, but looking at the kidney fat both around the kidney and in the pelvis is a common method to assess animals' condition, and obviously there's no fat around this animal's kidneys or in the pelvic area. And then looking at bone marrow can also be useful, and biologists will routinely do that. And again, this is a bone marrow with essentially no fat left in it, the serous atrophy of fat, if you will. You need to be a little bit careful in terms of evaluating bone marrow fat in young animals because they haven't had the opportunity to store the fat, and of course they may still have bone marrow that's quite active in hematopoiesis. And then a scale that's worked out, and you can actually go to actually analytical techniques to determine the amount of fat that's remaining in the bone marrow. That's usually not necessary except for maybe research purposes, but this is a good fatty bone marrow, and this animal would be considered in good body condition. And then we go on down in terms of relative amounts of fat down to the gelatinous fat here at the bottom. Okay, I'm going to move on. I'm going to go through these fairly rapidly because I do want to at least cover some of the ones that I think are important. After going through starvation, I thought it was important to bring up this disease, chronic wasting disease. This is an unusual disease that occurs in Colorado and Wyoming in elk and mule deer. The etiology of this disease is not known, but it's a member of the spongiform encephalopathy group, and so I put down here prions with a question mark. We really don't know, but that, of course, is the agents that are being considered right now as the etiology of the spongiform encephalopathies. For a long time, this disease was recognized as a wasting disease in captive animals, hence the name chronic wasting disease. And so I put it right after starvation because this disease could easily be missed if animals were being looked at for and thought to be starving. The appropriate tissues, which obviously would be the brain, would not be taken necessarily, and so it would be potentially possible to miss the diagnosis on this disease if starvation was assumed when this might have been an underlying factor. The host of this disease that we've recognized the disease includes mule deer, white-tailed deer, and elk. As I mentioned, distribution Colorado and Wyoming, but in January a case of chronic wasting disease was recognized in an elk on a game farm in Saskatchewan. And that animal is, the herd was depopulated. It was a fairly small herd of elk. That animal had come from South Dakota, but had no direct connection as far as we know to Colorado or Wyoming, and there's a lot to be learned in terms of the epidemiology of this disease. In terms of episodiology, it is locally sporadic. We're up to about around in the neighborhood of 70 cases or so in the wild, with maybe 100 or so cases recognized in captive facilities in Colorado and Wyoming. We don't know if it occurs elsewhere, and we don't know how the disease is transmitted. We presume by looking at our captive animal that lateral transmission or horizontal transmission does take place. We can't rule in or rule out maternal transmission, but it's certainly, considering these groups of diseases, is a potential. And we don't know what the population effects may be, though modeling right now shows that if maternal transmission is an important factor in the transmission of this disease, then there could potentially be population effects. But right now we don't know enough to say what kinds of effects there may be. The clinical signs of chronic wasting disease include emaciation, which you might guess from the name of the disease. Very prominent are behavioral changes. And this is in particular if in the captive situation, if you know a particular animal, you recognize that the animal is not acting the way it used to. So the animal caretakers are actually the first to pick up on changes in the animal's behavior. In the wild, this may mean things like the animal is less afraid of people, and that may be tied in, of course, to the emaciated state, with the animal not having enough energy to really care very much. Excessive salivation occurs, so these animals do oftentimes have saliva dripping from the mouth. They show polyuria, polydipsia, they drink a lot of water, they urinate a lot, and in some cases they may show ataxia. That's probably a little bit more common in elk than in deer, but we can see that. The gross lesions basically are emaciation. The animals are in very poor body condition. If the animals go to a terminal stage, in captivity now the animals are euthanized before they get that far. Because of the polyuria, the rumen contents tend to be very liquid to frothy. Urine is very dilute, again, because of the water consumption, though you have to remember in the wild situation they may not have access to water, and so you may not see the very liquid rumen contents and the dilute urine. And if the animals go to the terminal stage, aspiration pneumonia is fairly common. These animals do have a bit of difficulty in swallowing normally, and I think that's what leads to the aspiration pneumonia. Microscopically, it's a classic spongiform encephalopathy. In terms of diagnosis, the pathology is fairly straightforward. Obviously, if you get a fresh brain, if you have a decomposed brain, it becomes more difficult. Immunohistochemistry is being used now and is very useful. We can do electron microscopy to look for scrapie-associated fibrils, and then also Western blotting is being used if the tissues are to the point where we can't do adequate histopathology. This is what the animals look like, very poor body condition. I don't know if you can see that the animals do have, this animal does have a little saliva around the muzzle. The ears are down. The animal looks pretty depressed and kind of spacey. If, however, you came up to that animal, I mean, it would know that you were there and it would respond to you, but they tend to be somewhat depressed. The hair coat looks very poor here, and that's because it's springtime and the animal's shedding its winter coat. In fact, the animals do not show pruritus, so we don't get the scratching and itching type of syndrome that's seen with scrapie. So that the poor hair coat there is more a seasonal thing than a behavioral itching. Here's another animal, poor body condition. You can see the ribs and you can see the muscle atrophy along the back, kind of dull eyes, and then if you notice here there's a little bit of rumen contents around the nares, and that's from aspiration or from regurgitation. And this is another animal with wasting disease. The thing I put this one in for is because in some animals you do get quite a dilated esophagus. It's a fairly low percentage of animals, and fluid accumulates in this esophagus, and you can actually see the material bubble, if you will, in the esophagus. That's, again, a small percentage of animals show this, and I think that this, the consequence of this is aspiration pneumonia. And then this is a mule deer with a free-ranging mule deer with wasting disease. Poor body condition, doesn't really care that people are walking up on it. And you can see the animal still has grown, grown pretty good-sized antlers, which would suggest that the severe clinical part of this disease came on fairly rapidly, and certainly isn't something that came on early when the animal was growing its antlers. And some of these animals do get up on front porches. This is from Estes Park out of Colorado, and this animal is sitting on somebody's, or standing on somebody's front porch. Again, poor body condition, and that's basically all we see. Nothing very exciting about that. Elk look pretty much the same, very poor body condition. You see the ribs here and the saliva in the mouth. Again, poor condition, ears down, kind of a spacey look, but again, ability to respond should you come up to the animal. This animal's a little bit more alert and not in quite as poor body condition, but had a little bit of ataxia. In this case, you can maybe pick up that she's a little bit cockeyed in the way she's standing. Increased amount of rumen fluid, again, from the polyuria or polydipsia. And also sometimes we can have frothy rumen contents. There tends to be an increased amount of sand and gravel in the rumens, as well as this fluid and froth. And then aspiration pneumonia is common. It looks just like any other kind of aspiration pneumonia. When we look at the distribution of the lesions in the brain, this is the larger brains will be elk on this side, the smaller ones will be the mule deer on this side. It's important to look at the olfactory tracts, the olfactory tubercles, olfactory cortex here. The lesions do tend to be very prominent in this area. And if you can see on this side we have a normal brain through the olfactory regions, and then on this side we have an area of basically the same area of olfactory cortex showing the spongiform change, and it can be very striking. Again, if we go to distribution, not very much going on in the cortex, but if we look down in the thalamus into the hypothalamic regions, we can see a greater intensity of lesions. And histologically, again, a normal on this side and a spongiform change on this side. A lot of variation in the size of the vacuoles that you see. This is in the supraoptic nucleus, and of course supraoptic and paraventricular nucleus are involved, and this is probably an explanation for the polyuria polydipsia. Normal, and then greatly dilated or large number of vacuoles in the supraoptic nucleus there. Cerebellum can also be involved with vacuoles, cytoplasmic vacuoles in the Purkinje cells. And here we can see lots of vacuoles in these cells. And then a kind of a faint background of spongiform change as well. This is probably the area that you want to take, be sure to take. If you can't get the front part of the brain, if we get into the medulla and we look at the dorsal motor nucleus of the vagus in this area, the lesions are very striking in this area. And if I had a choice of one section to take, that would be the one I would take. I would say that basically I'd feel comfortable making a diagnosis off of that section alone. This is normal, and here's dorsal motor nucleus of the vagus here. And frequently we do get an interesting contrast between the dorsal motor nucleus of the vagus and the hypoglossal nucleus, which is right below it and is not nearly as affected. The classic spongiform change here showing the a neuron with intracytoplasmic vacuoles, in this case the multilocular vacuoles. And then this is an interesting I guess, point in the histopathology of this disease. We do see these plaques, you see here, surrounded by a spongiform change. And we recognize that, particularly in white-tailed deer, it seems to be fairly prominent. We do see it in mule deer occasionally. In elk, the plaques seem to be quite small. These do stain strongly for PRP when we use the immunocytochemistry, and with Congo red for amyloid. The interesting thing here is that the most recent description of cases of the variant Creutzfeldt-Jakob disease in humans, one of the features of the pathology of that disease are the occurrence of these fairly dramatic plaques that are very similar in the sense that, that they're surrounded by vacuoles. To my mind, that doesn't mean anything in terms of any relationship between these two diseases, but many of the spongiform encephalopathies don't have the very prominent plaques. This is with a Bodian stain, and again, the plaque stains very nicely, and then the surrounding spongiform change is quite obvious. With this is also with a silver stain, but we do have glial hypertrophy and presumably hyperplasia. And if you have control sections, you can see that there's a difference there. Again, with the Congo red, you can see the birefringence indicating amyloid deposition. And then with immunohistochemistry, these plaques and actually the PRP antigen does show up other places. We do electron microscopy looking for the scrapie-associated fibrils, which in this case we see here. All right, we'll move on then to viral diseases and some of the diseases that we know the etiology on and feel much more comfortable about, I guess, in terms of the etiology. Canine distemper is a very important disease in free-ranging wildlife, and it's a pretty commonly observed disease. Obviously, it's caused by a morbillivirus. You're aware of that, canine distemper virus. The most common hosts of this disease include, obviously, the canids. The mustellids, procyonids are the ones that we see, so that's the weasel family, and then also raccoons and associated species. And then, of course, more recently, there's been an outbreak in Africa involving the large wild felids, and then some outbreaks in zoos as well with wild felids. So we've got a lot more to learn about this particular virus in the felids. The distribution is widespread. As I mentioned, it's a common disease. In some places, there's evidence that the disease is enzootic and does cycle. But in our region of the world, out in the western United States, probably the disease is epizootic with about a 3 to maybe 7 year interepizootic period. We're doing quite a bit of studies on the epizootiology of that right now. In terms of population effects, the effects probably depend quite a bit on species. There's a range of susceptibility to the disease, so that when distemper goes through, say, a population of coyotes, Probably a certain percentage of the young of the year are lost, but many of the animals will survive and build antibodies, and we can detect those. On the other hand, species like black-footed ferrets are very highly susceptible to it, and I don't think any black-footed ferret survives exposure to this virus. So there's certainly some differences depending on species susceptibility. Transmission, as you know, is very similar to what it is in dogs. In the wild, we have aerosol transmission, and obviously direct contact. And the potential for fomites, though this is a delicate virus in the environment and likely doesn't survive for a very long time. Clinical signs, again, fairly similar to the domestic species. In mustelids in particular, skin hyperemia is quite prominent. The depression, of course, fever is common in these animals. We don't see that in free-ranging animals because we just don't have the opportunity to measure it, but certainly it does occur. Abnormal behaviors, for example, frequently when we have outbreaks in raccoons, we are first made aware of the outbreaks by people saying, well, we got raccoons out in the daytime and they're out coming onto porches and acting quite strange or not paying any attention to humans. And so abnormal behavior sometimes leads us to the outbreak rather than finding dead carcasses. We do get central nervous system disease in some species. Again, seems to be fairly common in raccoons where we actually can find animals having convulsions. And there are central nervous system lesions in these animals, as you might expect. Grossly, skin lesions are fairly prominent in some species. Again, the mustelids tends to be pretty marked. Occasionally we can see it in raccoons, though I have seen raccoons with chronic central nervous system disease where skin lesions were not a picture, or not part of the picture. Thymic atrophy can be very marked, and always look at the thymus, particularly in these young animals that are getting infected with it. Frequently it's very difficult to find thymus on affected animals. The microscopic lesions are very similar to what we know about in dogs. It is a systemic disease, and frequently we do see central nervous system lesions. The inclusion bodies frequently are pretty easy to find, intracytoplasmic as well as intranuclear inclusion bodies, the nice eosinophilic prominent inclusions. Frequently we do see secondary infections, so we may see pneumonia, may see dermatitis, these kinds of diseases, enteritis occasionally, and then as I mentioned, the lymphoid atrophy is like the thymus is basically completely depleted of lymphocytes, and you'll see depletion of germinal centers as well. For diagnosis, fairly easy to diagnose. The lesions can be helpful. Immunohistochemistry works beautifully for canine distemper. You can use a fluorescent antibody test, though I've been less happy with that. Electron microscopy of feces or of tissues from the animal by negative stain shows the virus very nicely. You can isolate the virus, though field strains of canine distemper virus can be fairly difficult to isolate. And then we use extensively serology on some of our predators because we're interested in looking at the epidemiology of the disease. For individual animal diagnosis, of course, these other techniques would be much more useful. Some of the things that you all are probably pretty familiar with an animal with canine distemper here: thickened eyelids. Usually there's a mucopurulent discharge from the eyes, from the conjunctiva, from the nares. The skin's a little bit thickened here. Again, mucopurulent discharge from the nares. May get thickened lips. These animals, look really miserable. We have seen canine distemper changes in the teeth or influence on the teeth, and this is from a young coyote that had some damage to the teeth at the same time an epizootic of canine distemper went through. So we do feel that the similar kinds of changes that have been described in dogs can occur in coyotes. I mentioned black-footed ferrets being highly susceptible to canine distemper, and they are. This is a captive black-footed ferret with canine distemper. The animal has been treated and so maintained for a longer time than the animal normally would have been, but the animal shows massive thickening of the skin with these folds and very marked hyperkeratosis, depression, fever, thickening around the lips. Can't really detect it here on the ears or the eyes so much. The ears are thickened. Again, the thickening. You can see the thickening of the ears as well. Hard pad is actually they don't see true hard pad, but we do see hyperkeratosis on the pads, so that this is a place to look. And mustelids tend to show that fairly dramatically, more so I would say than the canids, but also raccoons frequently will show thickened pads that are often cracked, and you may see secondary infections on the pads. There's a skunk. Again, the thickening of the skin, particularly around the nose, onto the lips here, very thickened, hyperkeratotic. You may see, again, nasal discharge, ocular discharge, kind of a pasting of the eyelids together. And then here's a skunk with quite thickened pads. Raccoon with canine distemper, kind of the more acute form. Here, again, ocular discharge, nasal discharge, thickening around the lips. In my experience, we frequently don't see raccoons coming in this way. We frequently see the central nervous system manifestation. So an animal may come into the necropsy looking perfectly normal on the outside, and even after the necropsy is done, the animal grossly looks pretty normal, except maybe fairly poor condition, body condition, but then histologically the diagnosis becomes apparent. Secondary infections, particularly bacterial infections in the lung. So pneumonia is quite common, and this is just a fairly low-power view of lung with a bronchus here and bronchial epithelial hyperplasia, inclusion bodies all over the place, and then a suppurative pneumonia and secondary bacterial infection. Lung, we've got intracytoplasmic inclusions, intranuclear inclusions quite prominent. Urinary bladder, again, typical of other species with canine distemper, lots of inclusion bodies, very easy to see. Don't need to go to any kind of fancy diagnostic techniques to do this. Hyperkeratosis can be quite marked. As you can see here, the hair follicles dilated with excessive keratin, and on the surface we have serocellular crust formations. You can find bacteria in there as well. And then if you look in the follicular epithelium, sometimes you can find inclusion bodies there as well. Central nervous system, I see the whole gamut of central nervous system lesions that you would expect to see. Non-suppurative meningoencephalitis, of course, is characteristic, and here we have an infiltrate of lymphocytes. We can see demyelination in the brain, and here have cerebellum, and we do have demyelination in the neuropil. Again, luxofast blue can kind of show up the changes perhaps a little bit better. You see the changes in the myelin sheaths here, the non-suppurative infiltrate around vessels. And then we can see in glial cells, of course, the intranuclear inclusions there. And they can be very prominent. Sometimes you have to hunt for a while. And with immunohistochemistry, this is a badger with canine distemper. You can see that these neurons take cells take the stain. Looks like neurons here, but we can see it in the glial cells as well. Taking the stain, and then we have a vessel that's thickly invested by the lymphocytic cuffs. And then I did mention that we do electron microscopy frequently, doing negative stain electron microscopy on feces. If we want a pretty fast diagnosis, we can also do it on tissues as well. And we see here the nucleocapsids of canine distemper virus. Now, we can't differentiate that from some of the other paramyxoviruses, but obviously if the history all goes together and we put that together with the pathology, we can feel pretty confident we've got canine distemper. It is a fairly difficult virus to grow in culture, and so we generally don't go that route unless there's a particular reason to. Rabies. Again, I don't probably have to review very much about rabies. Of course, caused by Rabies virus, which is a member of the lyssavirus group. The common hosts include carnivores that are important in the episodiology of it, and of course bats. Or carnivores include, in this country at least, of course, red foxes, some gray foxes, foci of gray fox rabies, coyotes down in Texas, in particular, outbreak going on there that's quite important. Skunks, of course, in multiple places in the United States. Bats, fairly well distributed across the country. And then raccoons with a problem here on the East Coast. Interestingly enough, we have a lot of raccoons out in Wyoming, but we don't have rabies in the raccoons. The distribution of the disease, of course, is widespread. The episodiology of it is, you'd think it would be well known, but it is probably better known than a lot of other wildlife diseases. And it depends upon the species, it depends upon the location as to what's going on. There's a lot of interesting work done on typing out these different virus strains and how they cycle within wild species populations. And in terms of population effects, certainly there can be variable effects and a lot of modeling done to look at these particular effects. Probably density of the particular species can be quite important in the actual outcome in terms of how many or what kind of overall effects there are in populations. Transmission classically by bite wound and salivary basically injection of the virus into the next host. Clinical signs, of course, can be extremely variable, with abnormal behavior being the most important, animals tending to be aggressive, but of course that's species and individual variation there in terms of the type of clinical signs that are seen. Grossly, again, variable, but frequently we don't see very much. I will say that when we have a skunk come into our diagnostic lab that has porcupine quills in it, we would put our money on the fact that it would have rabies. So that seems to me to be a pretty good indication that rabies may be present in those animals, because skunks normally don't tangle with porcupines. Microscopically, again, characterized by a non-suppurative meningoencephalitis. That's pretty classic. And then we look for negri bodies, same as you would do with domestic animals. The lesions, of course, assist in the diagnosis. We also do fluorescent antibody tests routinely on rabies cases, rabies suspects, and that works very nicely on smears of brain. And then immunohistochemistry works very nicely on sections of brains if that's necessary. And this is the way diagnostic labs frequently see these animals. A lot of diagnostic labs don't really like to see the whole carcass in, particularly of this species. The skunks coming in. Being interested in wildlife myself, I like to have the whole carcass to work with, but I get overruled by the other people at the laboratory and by my boss. The lesions are typical non-suppurative meningoencephalitis. And then, of course, negri bodies. Look for negri bodies, and we've got a negri body there and there. Intracytoplasmic eosinophilic bodies within the cytoplasm. Okay, move on to another one. Parvo does cause some problems in free-ranging populations. We're talking here about canine parvovirus. Also, feline parvovirus can cause problems. And then there is another parvovirus of raccoons that's just a little bit different than the feline parvovirus, but the disease that is caused is basically indistinguishable. The common hosts of this, of course, are the canids, so coyotes, wolves. What we see with parvovirus, a variety of mustelids can come down with it, but there's differences in susceptibility, of course, of mustelids to these viruses. Procyonids, so raccoons, again, we've got a raccoon parvo and a feline parvo that can affect the raccoons, and wild felids, mountain lions occasionally, bobcats occasionally with feline parvovirus. So there's kind of a mix and match of hosts and viruses. Distribution of this disease is very widespread. In terms of the episodiology of this disease, probably it's enzootic in some areas if there are appropriate population densities to maintain the cycles of this virus. But in our situation, where there may not be quite as high a density of some of these species, we tend to see epizootic cycles that come through, and the interepizootic periods can be fairly long, actually. And we've just recently in South Dakota gone through an epizootic cycle where large numbers of coyotes were actually dying of canine parvovirus. The population effects probably depends to a degree on species. Once again, the young animals probably have a little bit harder time with this particular virus than the older animals, and there's been some work done on wolves to suggest that that's the case. In wolves. Overall, probably not major population effects, but there can be, again, loss of cohorts of animals should the virus come through and hit the young animals. The transmission, just like other parvovirus, pretty hardy virus in the environment. Fecal-oral transmission is important, and animals interacting with each other, of course, can allow for transmission. Clinical signs are typical of what we would see in domestic animals, and are characterized by fairly rapid onset of diarrhea, dehydration. The animals may become depressed, and some animals may show abnormal behavior. Grossly, you get a dehydrated carcass with evidence of diarrhea. The degree of hemorrhage that occurs in the gut may be variable. Some animals, particularly it seems like some of the cats, may see quite a bit of hemorrhage, but and sometimes in coyotes, but that is variable. So you don't always see the true hemorrhagic enteritis. Again, lymphoid effects, lymphoid atrophy, and particularly thymic atrophy can be very prominent. And of course, microscopically, you can see the thymic atrophy, but you also see massive depletion of lymphocytes in Peyer's patches. The lesions in the gut are typical of what we see in dogs, for example, with Parvo, with the necrosis of the mucosa, dilated crypts with debris, necrotic debris on in the lumens, and that's very typical. Nothing very difficult in terms of the diagnosis there. The lesions are pretty straightforward histologically. Electron microscopy on the feces or gut contents can be used for finding the virus by negative staining. There are various ELISA tests that can be used to look for the antigen. We generally don't use those in our laboratory, but there are some available. And then serology from animals if we're interested in looking at the epidemiology. Obviously, we don't use serology for diagnosing the disease in individual animals as they come through the laboratory, but more on a population basis. The lesions are pretty typical. This shows actually a captive animal, but we have here hemorrhage in the intestinal tract. This was from a captive bobcat. And this is from Coyote with canine parvovirus. We do see greatly dilated vessels, some necrosis of the enterocytes, hemorrhage in the lamina propria. And if we look a little bit closer, I might add that a lot of these sections are pretty decomposed, and if we're working with wildlife, that's a pretty common artifact that we have to work through, because frequently the samples that we get aren't always what we might like, and these animals were found dead out in the field, and so just to be able to get even these sections sometimes can be pretty good. But we frequently deal with decomposed animals and frozen animals, and we just have to learn to put up with those kinds of artifacts. But here, the guts, the mucosa is pretty much collapsed. We have dilated crypts, some bizarre changes occasionally in the enterocytes and the crypts as they attempt to regenerate and fill in the gaps, and then oftentimes a lot of necrotic debris on the surface and bacterial effects. And this just shows Peyer's patches and a marked depletion of the lymphocytes in Peyer's patches, along with the changes that we see up in the mucosa. All right, well, continue on with hemorrhagic disease, and I need to make the point that hemorrhagic disease is caused by two different viruses. It's kind of a generic term for the disease that we see in wild ruminants, caused by both blue tongue virus and epizootic hemorrhagic disease virus. So hemorrhagic disease doesn't just refer to the effects of EHD on deer, but refers to both blue tongue virus disease, associated disease, and epizootic hemorrhagic disease virus. And these are both orbiviruses, closely related viruses, but they are different. The common hosts of this particular virus includes the cervus, which is where we see the greatest effects, but we do have mortality occur in these other species, including pronghorn antelope and occasionally in bighorn sheep. The distribution of this disease is pretty widespread across United States, I should say, and in different parts of the country there's definitely different epidemiology, so that in places like the southeastern United States there are enzootic cycles of these viruses, whereas once again out in the western part of the United States, out in our area, we generally see epizootic cycles, with the disease being present infrequently and causing considerable mortality, but in the intervening years not being active. And there's a lot of work going on to try to understand what influences these cycles. In terms of population effects, the disease can go through and cause local population defects, particularly as it runs along riparian areas, along riverine areas where, for example, large numbers of white-tailed deer may be lost in these areas. And so there can be local population effects. Overall, probably not tremendous population effects, though, as I mentioned, large numbers of animals can die. And in this past fall, it was felt that probably 8,000 or 9,000 white-tailed deer died in the western part of South Dakota, the northeastern part of Wyoming. Such effects did influence hunting seasons, for example, in those areas. The transmission is by Culicoides varipenis, and probably a potential for other Culicoides to transmit in other parts of North America, but that again is under study. And that is a biological vector. There is replication, of course, of the virus in the Culicoides gnat or noceum. Clinical signs of the disease are variable. Typically, we do see fever in these animals. Again, it's pretty hard to measure in free-ranging situation, but experimentally they do develop a fever, generally fairly high. They tend to seek out water, and so they often are found, again, along the riparian areas. The animals become depressed. They may show lameness. Oftentimes, the animals are just found dead with no evidence of clinical disease, except maybe a little kicking around in the dirt. And if the animals do survive, some percentage of animals will develop chronic disease, perhaps associated with lameness, also probably associated with rumen damage and interference with absorption of nutrients, so that the animals may linger on through the fall period and actually die later on in the winter in an emaciated condition. The disease does occur in the fall, so late summer, fall, when as many arboviruses do cause their damage at that time of the year. It's very typical of the hemorrhagic diseases to be active at that time of the year. Once a good hard frost comes along, then we see a decline in the number of cases that are reported, to a point where there's, again, no more cases after our good hard frost and loss of the vector. The gross lesions in this disease, again, are variable and probably depend upon the particular species and also upon the particular serotype of virus that the animal happens to be infected with. The most prominent signs that I see can be quite subtle. When I see a mule deer with hemorrhagic disease, frequently all I see is a dead animal with pulmonary edema, which can be quite subtle. Ruminitis and rumen hemorrhages may occur. Particularly in white-tailed deer. I don't see that so frequently in mule deer. Hemorrhages on serosal surfaces, again, tend to be more prominent in white-tailed deer than what I see in mule deer. Pronghorns show quite a bit in the way of hemorrhages. We can see oral lesions, glossitis, damage to the dental pad. Laminitis can be prominent, and you can have damage at the coronary band to the point where hooves actually, if the animal lives through the acute phase of the disease, may actually slough their hooves. And then I mentioned before the rumen atrophy, which follows the ruminitis in those animals which survive the infection, or may follow that. Some animals clearly become infected and may develop a brief illness, but do recover, and we can detect that when we do serologic surveys and find that following these outbreaks, we tend to have populations of deer or antelope that have high levels of antibodies. Microscopically, once again, can be extremely variable. Pulmonary edema seems to be very common. The hemorrhages may go along. We may see evidence of DIC, since these viruses do damage endothelial cells, and you can get widespread damage throughout the body, and may actually end up throwing the animal into a disseminated intravascular coagulation syndrome. Stomatitis, as I mentioned, the oral lesions can be present, and microscopically they're very non-specific type lesions. Again, ruminitis, as I mentioned before, and occasionally we do see non-suppurative meningoencephalitis, particularly again in white-tailed deer, and in this case with epizootic hemorrhagic disease rather than blue tongue, though we haven't seen this in a large number of cases. Diagnosis of the disease, we can at least make a presumptive diagnosis of hemorrhagic disease fairly readily. The history, including the time of the year, can be helpful. History of large numbers of, at least in our area, large numbers of deer or antelope being found dead. We sometimes get a history that indicates domestic animals may be involved, particularly sheep, but actually that's fairly rare. Generally, the disease seems to focus on the wildlife and not so much involve the domestic animals that we recognize. Lesions can be helpful, particularly if you have the kind of classic disease or gross picture with a lot of hemorrhages or pulmonary edema that you can pick up fairly readily, if you know what you're looking for at any rate. There are some fluorescent antibody tests. We're not real happy with the FA test. Virus isolation can be done in laboratories that are set up to do it, and actually have had pretty good luck with virus isolation. There's a number of new tests that are being evaluated, some immunogold tests, electron microscopy, PCR, that are coming along. None of them really in broad use in diagnostic laboratories right now. And then serology, we use the immunodiffusion as a screening kind of test, and then look at serum neutralization or competitive ELISA tests for helping to sort out exactly what virus might be involved, and that obviously is on a population basis and not really used on animals that come into the diagnostic lab, individual animals as they come into the diagnostic laboratory. Frequently this is what we see, an animal that's dead. Obviously it's been kicking around just a little bit in the mud. Oops. There around the animal, and you can see that it's gone to an area, a wash at any rate, that has a little bit of water in it. These animals do develop a high fever and they seek out these regions. Okay, and you can see where the animal's been kicking around. We get into the animals. This is frequently about all you may see is evidence of pulmonary edema, maybe a little bit of hemorrhage in this lung, a little bit of prominence of interlobular spaces, and then we have clear to generally clear excess fluid, can be straw colored, can be a little bit red tinged in the thoracic cavity, and may see a little bit of fibrin in the fluid. And then we have a lung here which shows interlobular edema. And that animal had epizootic hemorrhagic disease, but that was about the only lesion. That was the extent of the lesion in that animal. This is a pronghorn with hemorrhagic disease. You can see the trachea is opened up, a lot of froth and foam indicating pulmonary edema in the trachea, between the tracheal rings, an accumulation of fluid, and just heavy, wet lungs, but not very much in the way of hemorrhage. Hemorrhages on the pulmonary artery are something that we're kind of taught to look for, and in white-tailed deer we do see that lesion. I don't see it so often in mule deer, so there may be some variation. This is just to show accumulation of fluid in the pericardial sac. We open the animal up. We can see hemorrhages on the endocardial surfaces, of course, a non-specific type change. Occasionally we will see areas of necrosis in the heart, and this would be in an animal that has recovered from the acute phases but still has some myocardial damage. Serosal hemorrhages on the surfaces. This would be on rumen, and you can see the animal's in good body condition, but there are a lot of hemorrhages on the serosal surfaces, particularly obvious on the rumen and on the abomasum. And here's rumen opened up, and you can see the hyperemia, and in fact, if on closer inspection, there actually is hemorrhage in the wall, in the lamina propria of the papillae. We can see it. If the animals live a little bit longer, not only do you have hyperemia, but you also have clumping of the papillae with fibrin, and the material, of course, the ingesta going through will cause these papillae to clump, and then they will slough off eventually, and then we may end up with a rumen that looks like this, where basically the animal has little ability to absorb the nutrients from the rumen, and this may lead to the emaciated state that we do see sometimes, occasionally hemorrhages in the abomasum and also on the serosa. I mentioned the laminitis that we do get, and occasionally you can get damage to the coronary band. You may see very distinct bands across the hooves, which may actually lead to cracking of the hooves and sloughing. Microscopically, it's generally not as exciting as you might guess. Pulmonary edema, once again, a lot of fluid in the alveolar spaces. All right, I want to go on to just mention a disease that is fairly recently recognized, deer adenovirus, and I put this on following hemorrhagic disease because this disease probably was confused with the hemorrhagic disease in California until it was recognized that some animals that were dying of a syndrome that looked very much like hemorrhagic disease were in fact dying of another infection caused by an adenovirus, which is kind of an unusual situation. And so I'll just show you just a couple pictures of what this looks like. Basically, the adenovirus affects the endothelial cells, and you get essentially a DIC type of disease syndrome, which clinically and grossly looks very, very similar. And this section of lung, see the damage, endothelial damage and vasculitis that can occur. And the virus makes lovely large intranuclear inclusion bodies in the endothelium, vascular endothelium, which is relatively easy to find if you know what you're looking for and are tuned into looking for nanovirus. So in cases which present that look like hemorrhagic disease, it pays to look for potentially other viruses as well. I put this one in because we have seen occasionally adenovirus infections in deer, in this case in mule deer, where this was just considered an incidental disease, and whether these viruses are the same or not, we don't know. But in collecting ducts and medullary renal epithelium, we can see in a few animals, we've seen, again, large intranuclear inclusion bodies in these cells, with no apparent disease associated with this particular adenovirus. And by electron microscopy, we can take these inclusion bodies and determine that they are being induced by adenoviruses. And I can see the appropriate type of morphology of these viruses. Now I move on to a couple of diseases that aren't so important in terms of population effects, but I put them in because they're very common diseases. Of not a lot of consequence to, as I mentioned, to populations or to individual animals, but they do appear for the public as to be something unusual, so we get a lot of questions about it, so I wanted to mention them. Fibromas are very common on deer, caused by Papillomatosis, which is different virus than, for example, the virus that may cause fibromas in other species, say cattle, for example. The hosts of this particular virus are the cervids, and that's the deer family. Distribution is widespread, occurs across North America, and as I mentioned, these diseases these viruses and the fibromas that they cause are very common. Frequently, there seems to be an increased occurrence of these fibromas in males, though that may just be a bias of the sampling process, which frequently is hunter-collected animals. The hunter takes an animal that has fibromas on it and then gets concerned that wondering whether the meat is acceptable for human consumption. It doesn't have significant population effects and generally doesn't really have much effect on the individual animal unless the fibromas are in places that cause damage to the individual animal. Clinically, these fibromas are skin masses that are oftentimes pedunculated, coming off of the skin in various places, oftentimes around the head, but not always. They may frequently be single, occasionally we have multiple, and in some cases there are really massive numbers of fibromas on individual animals. Grossly, as I mentioned, very easy to identify, nothing difficult in terms of diagnosis. Microscopically, these are very well differentiated fibromas, and the diagnosis of these, again, easy because the gross is typical, the microscopic lesions are typical. If you want to get fancy, you can do immunohistochemistry for papillomaviruses, and you can find antigen in these sections in the epithelial covering. And then you can do electron microscopy, but again, that's definitely not necessary for a diagnosis because the diagnosis is clear. Well, let's see, are we missing? There we go. This is an animal that has a fibroma on the eyelid, and that's not an uncommon place for the viruses, the fibromas to grow, and this can of course cause that animal a little bit of trouble on that particular eyelid. Occasionally the cornea may be scarified and some damage that way. Now this animal obviously is having problems with it. You get multiple fibromas. Some of these may become scarified on the surface and you may get secondary bacterial infection. If they're heavy enough, they can cause problems with movement of the head or movement of the leg, so that the animal may have trouble either foraging or getting away from predators. Here's another, is a white-tailed deer with large numbers of fibromas, some of which are secondarily infected on the surface. This is just a non-pigmented fibroma, a very pedunculated mass, very typical fibroma, well differentiated, of no concern to the hunter. These come right off with the skin and aren't a problem. On cut section, very typical fibroma, smooth connective tissue. This is from an elk, and this is a small fibroma. While deer grow large ones, or they may be variable size, but oftentimes, or sometimes they can get large, the fibromas that I've seen in elk tend to be very small and fairly difficult to find, and we don't see the florid type cases that I just showed you in the deer in elk. This is from a moose and a fibroma, and actually in the center of that there was quite a lot of bone formation as well. And that probably did influence or interfere with the animal's movements. If that happened in the winter time, it would be difficult probably for the animal to get through deep snow. These will regress and go away, and the animals can be fully recovered. This is a pronghorn antelope. This is the ear of a pronghorn, and there's a little fibroma actually more of a papilloma in the ear of skin of the ear. They tend to be very small in pronghorn and not very common. And this is the typical fibroma, very well differentiated and nothing unusual in terms of the histopathology. Papillomatosis also occurs, and again I mention this because it's something people do see. Trappers in particular send these in and are concerned about whether they're going to get warts all over their hands or something, but they are concerned about this. Again, a papilloma virus. We see this most commonly in coyotes and other parts of North America. It's been described in wolves, and the virus is very closely related, if not identical, to the one that causes papillomatosis, oral papillomatosis in dogs. The epidemiology is sporadic. We occasionally have outbreaks and may have large numbers of coyotes affected at one time, and we may go for years without seeing a case, and then it recurs. There probably are areas where it may actually be enzootic, and we have a few populations of coyotes where that may be the case, though we haven't studied it in great detail. The population effects are not significant, and transmissions by direct contact. The epithelial surfaces of these tumors has a lot of virus in them, and so they're readily transmitted. Clinical signs, obviously you see these oral papillomas. Interestingly enough, even in cases that are quite severe in terms of large numbers of papillomas, the animals do tend to be in good body condition, so it doesn't really seem to interfere with their abilities to catch prey or to consume the prey. The gross lesions are the typical oral papillomas. Sometimes they will extend down into the esophageal mucosa, and then they are typical squamous papillomas, nothing unusual in terms of the histopathology there, and the diagnosis is fairly straightforward. And this is a coyote. The skin's been taken off the head, but we can see multiple papillomas along the lips, also involving the tongue, on the gingiva, and once again, large numbers of papillomas here. Down the esophagus opened up and multiple papillomas, but again doesn't seem to have too much effect on the individual animal, and they're very typical papilloma squamous, for the most part well differentiated papillomas. But we do get questions about that, so I put that in. Another one that we do see occasionally, and this is a disease that occurs primarily in Bighorn sheep, is contagious eczema caused by Parapox virus. Same virus that causes the disease in domestic sheep. We see it, as I mentioned, in Bighorn sheep. Occasionally it occurs in mountain goats, has been reported from Canada, causing some problem there. There's been some outbreaks in muskox. We have seen a case in pronghorn. Naturally and experimentally, a number of other species can be infected, though it doesn't seem to be a progressive type disease. And it does occur throughout Western North America. Obviously, these are the species that we're talking about, and they're found in the West for the most part. This again tends to be a sporadic disease with sporadic outbreaks where large numbers of animals in these particular herds may be affected, but we do have some evidence that in some bighorn sheep populations this disease virus may circulate, and so it may be maintained in an enzootic situation. In terms of population effects, some young may die if they get a particularly severe case, either on their lips so that they tend not to nurse, or occasionally can get up onto the eyelids and may cause the animal some difficulty in vision. And the managers are obviously concerned about this. Losing young animals is of concern, but also if the hunters go out and take these animals at the time when an epizootic is going through, that can cause problems because the hunters come back wondering what is going on, and of course there's the public health concern there. And then I've seen it several different occasions when animals were trapped for translocation as a management tool. When the animals were actually under the net and captured, it was determined they had contagious eczema, and so there was concern about moving diseased animals, and so oftentimes if this disease is active, the transplants are not done. Transmission, again, direct contact. This is a Parapox virus. It's a tough virus in the environment, and it does hang around for long periods of time and is quite resistant to environmental conditions. Clinical signs, pretty much like what you expect to see in domestic sheep, though perhaps can be a little bit more florid, a little bit more proliferative. You can see ulceration, secondary bacterial infections, again primarily focused on the oral cavity, but you can see lesions up onto the eyelids or even on the feet or around the teats of the dams. If the animal survives, which most of them do, the skin may be depigmented and you can have some scar tissue formation, for example, on the nose, which obviously isn't of too much concern to these sheep. The gross lesions are typical. Occasionally you do get animals that become emaciated if for example, lamb is not willing to nurse because of lesions on the lips, or the ewe isn't willing to let the lamb nurse because of lesions on the teats. Microscopically, nothing very exciting and not any different than what you would expect to see with contagious eczema in domestic sheep. Diagnosis: the lesions are pretty characteristic. The virus is big and it's easy to see by negative stain electron microscopy, and it can be grown as well. Serology is used again to track the episodiology of this infection in bighorn sheep. And lesions here on the dental pad of a bighorn sheep, and maybe a lesion up here on the lips, and over here on the side, the oral cavity. Here again, large ulcerative thickening of the lips along the oral cavity here on the gingiva between the teeth. And once again, it can be fairly nasty looking. The tissue is quite friable, and obviously in this situation you have quite a bit of hemorrhage going on. If these animals are trapped, the trauma from the net can cause a lot of damage. They go ahead and heal, and you end up with scar tissue on the nose and depigmentation. It is of concern, though, in terms of moving animals around and in terms of management. A few things on birds. I haven't said very much about birds. Some virus infections. Avian Pox Virus we see occasionally. The hosts that I commonly see pox virus infection on include waterfowl, probably more common in raptors than anything else, and occasionally in wild turkeys. The distribution of this disease is widespread. I see them as sporadic outbreaks, but there can be a more enzootic type of episodiology, and there it can be locally important, particularly in some of the southeastern wild turkey populations. Again, there's possible local effects of this viral infection. In our situation, there really wouldn't be any population effects. Transmission, again, pox viruses are tough in the environment, resistant type viruses, and so they're spread by direct contact, and also the virus can be left on fomites, in particular on perches if the feet are involved, and large numbers of virus are shed from the epithelial surfaces, and then it can be picked up by the next animal to come along and use a particular perch. The lesions are typical of avian pox virus seen in other birds with a proliferative dermatitis, and occasionally it may be so severe that there may be interference with ability to feed if the lesions are around the eyelids or around the beak, or especially if the lesions on the feet are too extensive. Grossly proliferative dermatitis, again, it's easy to diagnose grossly. If you want to confirm it, there are other ways to do that. You can go on to the microscopic lesions and look for the inclusion bodies, which are typically very large. And negative stain electron microscopy can be very useful if we want to pin it down to a pox virus. And what do we see in the raptors? This is an animal with proliferative pox virus lesions around the eye, maybe a few up here on the cere and on the feet. Lesions on the feet are probably more common than they are elsewhere. This turned out to be a falconer's bird, but it also had lesions up here on the skin of the ventral portion of the body as well. This is a wild turkey with pox virus infection. Now that looks a little bit different than what you typically expect to see with pox infection. Turkeys tend to have feather loss and then a very thickening and crusting of the skin and also around the beak, around the eyes, but it's not proliferative in the sense that we saw with the raptors, and so it looks a little bit different. But the lesions are loaded with virus. This is more typical of what we see with the raptors, and the thickening proliferative type lesions, oftentimes secondary bacterial infection in these pox lesions, and see thickening of the epithelium, oftentimes serocellular crusting with secondary bacterial infection. And if we look a little closer, we can see the typical large pox virus inclusions, which oftentimes fragment, just they're so large they don't section well. Another virus infection of birds, duck virus enteritis, and I put this one in not because we see it commonly in free-flying birds, but because of concern should it get out into populations of free-flying ducks. There have been been one very large outbreak with many thousands of birds dying of this disease, and so there's been concern on the part of a number of management agencies that should this disease become established in free-range or free-flying bird populations, that it could cause considerable concern. So we want to be on the lookout for this. It is caused by a herpes virus, duck virus, enteritis virus. The hosts include ducks and geese and swans, so we're looking at waterfowl here. It is uncommon in free-flying birds, but it is seen in smaller kind of backyard flocks, occasionally in city parks, this kind of a situation, but not really so much in our free-flying bird populations. There are a few examples, but not very many. As I mentioned, there was a very large outbreak, which something around 50,000 birds died in, that caught everybody's attention, and so there has been heightened awareness and concern about this particular disease, but we do see it in captive waterfowl. And as you might expect with herpes viruses, some birds can become carriers, and presumably then with appropriate environmental conditions or stress on those birds, they can break with the infection or break with shedding and potentially transmit the disease that way. Population effects, there may be local mortality. We don't know what might happen should this virus get established to a greater degree in our free-flying birds, but as I mentioned, it is a management concern by those agencies that are responsible for managing free-flying waterfowl. Transmission, direct contact, probably aerosol transmission, and as I mentioned, in carrier birds, under appropriate kinds of conditions, you can have recrudescence and shedding of the virus. Clinical signs are somewhat variable. The animals become depressed. It's a systemic disease, of course. It does affect the intestinal tract, so you do get, or you may get bloody diarrhea, a gross lesion that is not specific by any means, but prolapse of the penis can be seen, and then frequently the mortality is very acute, so you don't see very much in the way of sick birds involved in these outbreaks, but you do find dead ones. Grossly, markedly ulcerative and hemorrhagic lesions in the digestive tract, and then particularly over the lymphoid tissues. Can see lesions in the liver and in the spleen, multifocal areas of necrosis, which doesn't necessarily help you differentiate that from another important disease of waterfowl, which can cause high mortality, which is fowl cholera, and we'll talk about that later. Microscopically, mucosal necrosis and ulceration throughout the digestive tract, the hepatic and splenic necrosis, which is fairly typical of herpes viruses, and the intranuclear inclusion bodies are pretty readily identified. The lesions are pretty characteristic and can help you on the diagnosis of the disease, in particular looking for these inclusion bodies, and then you can go to things like electron microscopy, a negative stain electron microscopy looking for the virus, and then the virus isolation. Bird with duck virus enteritis, depressed bird, not willing to move, bloody exudate coming from the nares. Occasionally nervous signs can be seen. This animal's with its torticollis, opisthotonus, prolapse of the penis. Hemorrhages do occur on the heart. You can see that, first of all, these animals are in pretty good body condition, so the birds die acutely, and we can see occasionally hemorrhages on the heart. Again, a non-specific type change, and then multifocal areas of hepatic necrosis. Again, a non-specific change. We can see that in fowl cholera in particular, and other diseases, but in particular fowl cholera is a main rule out. And then ulcerative changes in the esophageal mucosa. And you can see bands of necrosis and ulcers when we get on the inside of the intestinal tract. Here, ulcers over lymphoid tissues here, button ulcers, and then on down into the cloaca. A lot of necrosis, hemorrhage, a lot of fiber and exudation into the digestive tract. As I mentioned, that's an important disease to recognize, in particular to differentiate between duck virus enteritis and fowl cholera. Then we have another herpes virus that we see sporadically in owls and falcons, and is presumably related to herpes virus that occurs in pigeons. The evidence is that these are very closely related herpes viruses. The pigeons seem to carry this disease, this virus, without very much in the way of clinical disease, though I have seen a pigeon with disease associated with this virus, but that's unusual. What we generally have presented to us are dead raptors, in particular dead owls and dead falcons. The distribution of this disease is quite widespread. Not a lot known about it. The epizootiology is not well understood, though it appears to be sporadic, but in terms of population effects, we really don't know. And the transmission presumably is by oral transmission, that is a falcon or an owl taking a pigeon carrying this particular virus. At least in my experience, the deaths are quite acute. We have a situation where we have owls that roost on the old main building on campus at the University of Wyoming, and about every 4 or 5 years we lose a bunch of young owls due to this particular disease, and people watch these owls very closely, and they're fine one day and we get them brought into us dead the next day. So I believe that the disease has a very acute course and the animals die without showing much in the way of clinical signs. We have seen, as I mentioned, pigeons occasionally do get proliferative mucocutaneous type lesions, but that's unusual. Generally they carry it without any clinical disease. In the raptors, we see multifocal necrosis that occurs in liver, spleen, can occur in bone marrow. You do frequently see areas of necrosis in the oral cavity, and occasionally we'll see disease or necrosis occurring in the intestinal tract, though that's a little bit unusual. Microscopically typical areas of multifocal necrosis with intranuclear inclusion bodies. And diagnosis is fairly straightforward, again, by pathology looking microscopically for the inclusion bodies, and by negative stain electron microscopy we can readily find the virus. Oral cavity of an owl opened up with the necrosis in the oral cavity. May not always see that, but that's a pretty good hint when you're starting to do the necropsy. And then in the internal organs, on the liver in particular, we see areas of multifocal necrosis that can be somewhat variable in size. Histologically, liver here, a large area of necrosis with necrotic debris in the center, and then of course if we look in the periphery of the focal areas of necrosis looking for inclusion bodies, and we can see intranuclear inclusion bodies in some of these hepatocytes. This is a bird with a pigeon, with pigeon herpes virus, and see the dilated hydropic type change in the oral mucosa, and in the liver you see very large intranuclear inclusion bodies. And then by negative stain electron microscopy can readily find the virus in the tissues of these birds. Now we're going to shift gears and go from viral infections to bacterial infections, and talk first about brucellosis. As it occurs in free-ranging wildlife, of course caused by Brucella abortus in elk and bison, which I'll talk about primarily. We do have Brucella suis, which occurs in caribou and reindeer, and also in feral swine. I will talk, as I mentioned, primarily about the situation in elk and bison, but do be aware that it occurs in other species. Distribution of brucellosis in wildlife, we're looking at a situation where we have it in the greater Yellowstone area, which includes parts of Wyoming, Montana, and Idaho. It also occurs in bison in Wood Buffalo National Park in Canada, and then, as I mentioned, in the caribou in the Arctic. And in feral swine, particularly in the southeast, across parts of Texas and into California. The disease is enzootic and maintained in some populations of free-ranging animals, and is not a disease that is continually being reintroduced from domestic animals, and so it is being maintained in free-ranging populations. The population effects, though, are minimal. Even though the disease does cause abortion in elk and bison, the populations continue to grow, so it's not a limiting disease, and biologically doesn't cause very much problem in these populations. However, there are significant management concerns, of course, because of the potential for transmission back from the wildlife to domestic animals in the face of an eradication program, and that's where the disease becomes highly important. Transmission is by direct contact, obviously, with aborted fetuses, placentas, fetal fluids is the mode of transmission, and potentially the disease could also be transmitted via milk. Clinical signs in the ruminants include abortions, and clearly that happens in elk, and it happens to a degree in bison, though the actual prevalence of abortion following infection with Brucella abortus isn't truly known. Lameness, the the bacteria can affect the joints, and so lameness can be a problem in a small number of animals. Particularly infected hygromas can occur, so you can get arthritis as well as infected hygromata. Retained placenta can occasionally occur, particularly in bison, and the subsequent influence on reproductive ability isn't really known. And in bulls, in bison bulls, epididymitis and occasionally orchitis can occur. That does not seem to be a problem in the elk. Grossly, usually there are no lesions. If we have a fetus, they're generally on a gross examination, not very much to see, though the fetuses tend to be somewhat decomposed. Grossly in the bulls, that is in bison bulls, we can see enlarged testicles and inflamed epididymi. But gross lesions are fairly nondescript. Microscopically, the lesions are characterized by lymphoplasmacytic infiltrates that occur in the reproductive tract, particularly in the uterus in the cows, and in the epididymis and ampulla, the secondary sex glands of the males. And then in an aborted fetus, just like you'd expect with cattle, you do see a suppurative bronchopneumonia. There is if you have the opportunity to get the placenta, of course you can see a pretty marked placentitis as well. The diagnosis is relatively easy. The bacteria is fairly readily grown as long as it isn't too contaminated and you have a laboratory that's geared up to do the culturing. The lesions are nonspecific but can be useful. Immunohistochemistry can certainly be used to identify antigen in the tissues, and serology is used to study this disease in terms of populations and not so much on an individual animal basis. This is the reason why we have the problem is because the animals are concentrated on feed grounds in the northwestern part of the state, and some of the populations are quite dense, particularly in bison in Yellowstone National Park, and behaviorally these animals group together during the wintertime. The disease was probably introduced into these free-ranging wild species around the turn of the century from cattle, so it's probably a domestic animal disease that's now in wildlife. It's not an indigenous wild animal disease, but now these wild animals serve as a major potential reservoir for the domestic animals. This animal's on a feed ground. This elk is on a feed line, and this is feed that's put out. It's a trail of pelleted alfalfa put out for about 1,000 animals that are feeding on this particular feed ground. That animal's just aborted, and she's reaching around to pull the placenta out, and at the same time, of course, shedding large numbers of bacteria on the feed line. When those animals that are off hiding in the bushes over here come back down to feed, of course, they're going to become exposed to the bacteria and hence perpetuate the problem in that particular feed ground. As I mentioned, abortions, the main thing that we see in elk. We do occasionally get fetuses in, and the lesions that you see grossly aren't very exciting. Again, the fetus dies in utero and so tend to be somewhat decomposed, but microscopically we see a very typical suppurative bronchopneumonia, and there's an infiltrate of neutrophils into alveolar spaces with a little bit of fibrin in the lung. Placentitis can occur if we're lucky enough to get the placenta. Elk eat the placenta, and so do bison, and it becomes very difficult to get placentas to take a look at. But when we occasionally do get the opportunity to get placentas, we see a fibrinonecrotic kind of superficial layer on the placenta. This is a cow that had recently aborted, bison cow, with endometritis, and there's a lymphoplasmacytic infiltrate into the uterine lamina propria, the lumen filled with necrotic debris, some fibrin, and neutrophils, and a lot of bacteria. In bison, not in elk, but in bison, we can have epididymitis, occasionally orchitis. There's the epididymis showing lymphoplasmacytic interstitial infiltrates and debris, and some inflammatory cells within the lumens of the epididymal tubules. I mentioned lameness associated with inflamed hygromas, and also arthritis and inflamed tendon sheaths. This is a swollen tendon sheath and on down into an arthritis in this particular elk. And if you open those sheaths up, you can find on the inside a lot of purulent exudate frequently in these areas, and it's just teeming with bacteria, easy place to grow the bacteria from. Occasionally these will become chronic. This was an elk that was a hunter-killed elk, and you can see the extremely large swelling, firm with a lot of connective tissue and bone formation in these legs from this elk. And if we open that up, a lot of connective tissue and, as I mentioned, bone proliferation, but the fluid and kind of organized fibrin within the joint space, again, was just teeming with bacteria. I mentioned a few words about bovine tuberculosis, and that's not because right now we have significant evidence that the disease is important in free-ranging wildlife, but we are concerned about that. It has been a major problem to the eradication program to have bovine tuberculosis occur in captive game farms that specialize in cervids. The evidence from free-ranging wildlife is that we have recognized the work done in Montana has come up with a couple cases in mule deer and in coyotes, and then more recently some evidence of bovine tuberculosis occurring in white-tailed deer in Michigan. But other than that, it doesn't appear that bovine tuberculosis is a problem in free-ranging wildlife in the U.S. The same herd in Wood Buffalo National Park that has bovine brucellosis also has bovine tuberculosis at Wood Buffalo National Park. That's obviously a very serious situation and a concern to wildlife managers as well as domestic animal managers in Canada. Variety of mycobacterial diseases in wildlife. I'll talk a little bit here about M. bovis. I'll say a few words about M. avium, which we do see sporadically in free-flying birds, and a little bit more about paratuberculosis, and the other ones I won't mention except to say that Mycobacterium leprae does occur in free-ranging armadillos, and Mycobacterium tuberculosis can be a problem in captive animals, but doesn't seem to be a problem at all in free-ranging animals. The pictures I'm going to show you here are from a game ranch, but I think it's important for you to see some of the differences between what bovine tuberculosis looks like in cattle, what we expect to see there, and what we do see in cervids. This was a herd in Colorado, a captive herd that was depopulated. The animals here are captive animals. These animals were in excellent body condition, so externally you would never guess that these animals had tuberculosis, and in fact out of the 44 animals that were depopulated, really only one animal was in poor condition. The rest were in excellent body condition. This is one of the major differences between bovine tuberculosis in cattle and what we see in the cervids. Cervids tend to form subcutaneous abscesses with Mycobacterium bovis infection. And so this is a subcutaneous abscess, if you will, opened up with this white purulent exudate flowing out on the ground. That's due to Mycobacterium bovis. Now it looks an awful lot like a large actinomyces abscess, for example, which are also common in elk or other cervids. But that's not. That's M. bovis. So watch for that. And then otherwise they can form very typical tubercles that you would expect to see with other species with Mycobacterium bovis infection, distinct tubercles here on the pleural surface of the thoracic cavity. But in the lungs, opening the dorsal and caudal portions of the lungs, you can palpate these areas of tubercle formation and interstitial fibrosis going on. I'll show you a few other places where there's real typical laminated tubercle formation, but these are typical of what you do see in an animal that has gone on and developed lesions beyond the lymph nodes of the head. This is in a bison from Wood Buffalo National Park, a lung, and a very extensive infection in this animal's lung with large numbers of almost confluent tubercles and granulomatous inflammation. And liver from again from a wood buffalo or a bison from Wood Buffalo National Park, and extensive miliary tuberculosis. Don't forget to look at mesenteric lymph nodes. We generally don't think about mesenteric lymph nodes so much in cattle, but in fact in the cervids it's not uncommon to find mesenteric nodes that have the appropriate granulomatous response and tubercle formation. And even in bison here, again, involvement of mesenteric nodes. And that doesn't mean you don't forget about the nodes of the head. Obviously, they're the most important nodes to really look at closely, tonsil and the pharyngeal nodes, parotid nodes, mandibular nodes are real important to take a look at, and lesions will be found there. This is a cow that had extensive lesions throughout her whole body, and this is the mammary gland in this case opened up, and it's essentially been replaced by connective tissue and tubercle formation, and a cut section of one of those tubercles showing a fairly typical laminated appearance with a central area of necrosis that's actually liquefied and run out. If you look at that microscopically, it's going to look very typical. The numbers of acid-fast bacteria that you may find is going to vary. Sometimes they're fairly easy to find, and sometimes you have to look pretty hard. Diagnosis, obviously the acid-fast stains help, but then there's also immunocytochemistry that's come along that can help, and other types of techniques are being developed, including PCR and things like that to make the diagnosis. Culture, of course, is important, but does take some time. A few words about avian tuberculosis. We do see it sporadically in free-flying birds, and this is a case that looks pretty typical of what we see with the lesions in the liver, and of course the liver is quite enlarged in this bird. Thing to note here is generally you think of birds being emaciated. This bird was actually in pretty good body condition, so I don't think it was it's necessarily its primary problem, even though it did have a lot of damage to the liver. It can also affect the digestive tract as well. This was an unusual case with lesions in the liver that were very, very large lesions and somewhat different than the miliary presentation that we typically think of. And then again, as typical of most of the mycobacterial infections, areas of necrosis surrounded by granulomatous infiltrate, frequently with multinucleated giant cells, epithelioid macrophages, and variable numbers of acid-fast bacteria. So very typical kind of mycobacterial lesions, nothing unusual there. A few words about paratuberculosis. Mycobacterium paratuberculosis causes Johne's disease or paratuberculosis. The hosts that we see this disease in free-ranging animals include bighorn sheep, mountain goats, and tule elk in California. The distribution is fairly limited in terms of significant disease associated with paratuberculosis to localized herds in Colorado, the tule elk in California, and there have been some surveys done in the Northeast and actually in the Midwest as well that indicate that occasionally white-tailed deer become infected with it and may carry it. Fairly low percentage of affected animals, but they don't seem to be very important, and certainly clinical disease is very rare. The population effects is probably minimal, except that when we're looking at small populations of bighorn sheep or tule elk with this infection, it obviously limits the management of those animals. You can't use those as source herds for transplanting, for example, and there are other management concerns related to the tule elk in terms of them being on a fairly small localized national park, and that causes problems in terms of keeping the herd within the habitat available to it, and how those numbers are maintained and is a source of some discussion. Transmission is typically what you would expect with paratuberculosis, fecal-oral transmission. And the clinical signs are pretty similar. Emaciation, if the animals go that long. We can see evidence of a chronicity of these diseases, showing poor horn growth, in particular in bighorn sheep. Diarrhea generally occurs as a terminal event, but we don't see the prolonged periods of diarrhea that typify the disease in cattle. This is typically seen more at the terminal stages. Grossly go along with what you'd expect. Emaciation, the animals are in poor body condition, enlarged lymph nodes in the mesentery, variable amounts of thickening of the small intestine. Sometimes it's basically very, very marked, and sometimes you can't really see it at all. And then thickening of the afferent lymphatics. Microscopically, a typical granulomatous enteritis and granulomatous lymphadenitis, as you'd expect with Johne's disease and other species. The diagnosis, the lesions, gross lesions can be very useful, but obviously to make a definitive diagnosis, you want to look for, you want to culture the organism or use other kind of techniques. There are PCRs available now and radiometric techniques which shorten the ability of the diagnostic laboratories to identify the infection as being caused by Mycobacterium paratuberculosis. Bighorn sheep with paratuberculosis, poor body condition, prominence of the bones, muscle atrophy along the back and over the hips, and some evidence of diarrhea down on the hocks. A chronic disease, as shown here, these are is a very deep groove in the horns, which indicates months of disease in this animal. Normally, the horns would show a little tiny ring, perhaps associated with wintertime food deprivation, but nothing like this. So this indicates a very severe check in the growth of the horns associated with disease. The animals may become hypoproteinemic, and this is a accumulation of fluid in the intermandibular space of this bighorn sheep with Johne's disease. Enlarged mesenteric lymph nodes, prominent afferent lymphatics. Obviously, poor body condition, not very much fat. This is a mountain goat with paratuberculosis, again, the enlarged mesenteric lymph nodes. Maybe some remnants of fat in that animal, but not much. And then in the goat, a mountain goat, thickening of the ileum and the mucosa thrown into folds. Thickening of the afferent lymphatics with considerable inflammation, and you can also get edema fluid accumulating in the mesentery. On cut section of the nodes, this is from a deer. You may actually see foci of mineralization in the lymph node associated with the granulomatous response. Don't see that so much necessarily in sheep and in in bighorn sheep or in mountain goats, and this is a little bit unusual for paratuberculosis in any species to see the areas of mineralization. This is tonsil, and we actually do have some granulomas with nice giant cells in the parenchyma of the tonsil. And this is from a goat. This is the gut, and I just show this. This is the muscularis down here, and here's the mucosa, and it's entirely replaced by a granulomatous infiltrate, which has essentially effaced any of the normal architecture of the gut. The inflammation is typical with epithelioid macrophages and numerous giant cells, and acid-fast staining shows the organisms generally in large numbers. Generally, they're not very hard to find. Again, isn't specific. You need to go to other techniques to define or to definitively diagnose it. Lymphatics, afferent lymphatics, in this case a particularly bad case with a marked perilymphatic mononuclear infiltrate, but also if you look closely there's also a granulomatous component to this with a lot of epithelioid macrophages thickening these lymphatics. We do see lesions elsewhere, not just in the gut. This is in the liver of a deer with paratuberculosis and a nice granuloma here with a big giant cell in the center. Acid-fast organisms in the liver as well. And one that's probably more important from a diagnostic point of view is this is lung from a deer with paratuberculosis. I can see a nice granuloma here, good typical giant cells, and one would obviously be concerned in differentiating lung granuloma like this caused by paratuberculosis from Mycobacterium bovis infection. The bacteria can be grown, as I mentioned, other techniques, and this just happens to be an auramine rhodamine stain on fecal sample showing the large numbers of organisms that are shed. These animals maintain the infection probably by behavior in terms of being very traditional in their use of particular locations in their habitat, and because they're so traditional, they seed the area with the organism. Now I'm going to shift from mycobacterial diseases to a number of diseases in Yersinia and Pastorellas can be quite important on population basis and also for public health. Sylvatic plague is a very common disease out in our countryside and out in the west, caused by Yersinia pestis, of course, an important disease of humans as well as of our free-ranging wildlife. We're looking primarily at effects on rodents, though occasionally carnivores can be involved, and even less frequently probably lagomorphs, which would be the rabbits. Distribution is in the western part of North America. This is probably an introduced disease brought into the San Francisco area around the turn of the century, and then is spreading across the country to the east, is at least the current thought. It clearly is enzootic within some populations, primarily looking at colonial rodents, but the epizootiology is not terribly well worked out. In terms of population effects, they can be variable, but in some highly susceptible species, this disease can essentially wipe out local populations of rodents such as prairie dogs or ground squirrels. It is of significance because of obviously the human concerns. Humans do get this infection, and it can be a fatal human disease. And then there are other concerns, and that relates to, for example, endangered species. Black-footed ferrets are dependent upon prairie dogs for their survival, not only for food but also for habitat in terms of the burrows that the prairie dogs make. And if the prairie dogs go, then the ferrets go too. So there are interrelationships here that are important. The disease is transmitted primarily by flea bite between the rodents, for example, but also oral transmission is possible, in particular with the carnivores. Clinical signs, once again, variable. We can have peracute death, and so essentially no clinical signs are seen, and I've seen that in prairie dogs where they can die very, very acutely without very much indication that the animals are ill. This is a septicemic disease. They have a fever. They may get depressed if they live long enough to show clinical signs, and they may show some degree of respiratory distress. Grossly, we may see occasionally pulmonary edema. Hemorrhage may occur, but in particular, we can see damage to lymph nodes and formation of buboes. In particular, with flea bite transmission, the draining lymph node can be quite enlarged and hemorrhagic, and so we always look for a bubo, if you will, in prairie dogs to determine where the animal might have been bitten by the flea. Hepatic necrosis and splenic necrosis occurs if the animal lives long enough. Grossly, sometimes you don't see that, whereas you may pick it up microscopically. And again, microscopic lesions, there is evidence of a septicemia. Usually the blood vessels are absolutely filled with bacteria. It's not difficult to recognize you're dealing with a septicemia. Pulmonary edema and hemorrhage may occur. Occasionally, if we take those lymph nodes, we see large areas of necrosis and hemorrhage, and again the splenic and hepatic necrosis with large numbers of bacteria present in these lesions, and tends not to be very much in the way of inflammation. These are quite acute. The diagnosis is based on the lesions that we see. Can do immunohistochemistry. The organism's pretty easy to grow as long as your bacteriologists are kind of tuned into the fact that they should be watching for this, and of course they should be careful when handling any of these tissues. And then we use serology in our carnivores in particular because they tend to be somewhat more resistant than the rodents, and we can use monitoring of serology from the carnivores to detect activity of plague in some of these areas. This is a prairie dog with plague, and the things to note here, the disease, of course, in humans in the past has been called the Black Death, and that's related probably to a DIC type situation. And here we have subcutaneous hemorrhages, and presumably in humans you get a similar kind of lesion, but we have a lot of hemorrhages in the capillaries and the subcutis where the skin basically looks very dark, or you may actually see petechia to ecchymotic type hemorrhages. The lung, to a degree, shows some modeling. If we go a little bit closer here, there is a pulmonary edema and a little bit of hemorrhage in the lung. This is the bubo I was mentioning to you in the lymph node, subcutaneous lymph node here. The vessels tend to be congested. That goes along with the septicemia, and the bacteria centered there, so there will be hemorrhage and necrosis in that lymph node. Now, generally we think of carnivores being fairly resistant to this disease. The exceptions, of course, are cats. Felids do get the infection and actually can be important as a mode by which humans might be exposed. As it turns out, while we've thought that mustelids were quite resistant in the past, it turns out they are susceptible to the disease. This is an experimentally infected ferret with the disease, and here's a bubo formed in a mandibular lymph node from a ferret. So ferrets are susceptible to this infection as well. Pulmonary edema, very congested blood vessels, and a lot of fluid in the alveolar spaces. And if we look closer, a little bit higher power, there's bacteria in the bloodstreams. We do see thrombosis. Endothelial damage can be a little bit difficult to appreciate, but we can see vasculitis and perivascular hemorrhage. And then if we do a Gram stain on these tissues or vessels, and here's a large clump of gram-negative bacteria, clumps of gram-negative bacteria and a lot of neutrophils in this vessel. We can do immunohistochemistry, and that's what we have here is a vessel, and we've got the bacteria picking up the stain here within the lumen of the blood vessel and in the perivascular fat. lymph node showing basically a total necrosis of the lymph node, just a few remaining lymphocytes here, and these purple foci represent just large bacterial colonies. So essentially the node is just turned into a bacterial production factory here, large numbers of bacteria in this node, and just a few remaining lymphocytes. Grossly, this would be in ferrets, but we do occasionally see this in rodents as well. You can see hemorrhage in the intestinal tract. Here the colon, and there's not very much involvement of the lamina propria, but when we get into the submucosa and on into the muscularis to the serosa, we can see some hemorrhages. I think we'll go on here and say a word about tularemia, caused by Francisella tularensis. It's, again, an organism that's fairly closely related to Yersinia. We see this in rodents, particularly muskrats and beaver, and also in the lagomorphs, probably a little bit more common in the lagomorphs. And we don't see the disease so much in carnivores, but we use carnivores as the monitors and do serologic surveys to detect the presence of tularemia. Distribution is widespread. Across the United States. The episodiology is being studied, and it does occur locally in some populations, probably in an enzootic situation, but we also see it in an epizootic situation as well. Population effects aren't terribly well understood. There probably are localized population effects, particularly in beaver and muskrat. Transmission, multiple kinds of transmission. This organism can get around by a variety of means, including waterborne if we're dealing with the beavers and the muskrats, potentially by ticks, oral transmission as well. Clinical signs, quite variable, include a peracute death with fever, and depression if you can measure those, and again respiratory signs sometimes happen. Gross lesions are variable. The vessels are congested as in any of these septicemic diseases. Liver and splenic necrosis can be seen grossly, again, if the animal lives long enough. And we can occasionally see pleuritis and peritonitis in some of these animals grossly, particularly in beaver. Microscopically, non-specific kinds of changes, lots of bacteria in areas of necrosis in the liver and in the spleen. And once again, we can look at the fibrinous pleuritis and peritonitis with fibrin and lots of bacteria. Diagnosis, the organism can be grown. It does require some special media, so the laboratories have to be up for looking for it. The lesions can be helpful but not diagnostic. Immunohistochemistry can be done. And serology is used for studying the disease in the wild and looking at the epidemiology. There's a beaver opened up, and the animal's got tularemia. Thing to note here is modeling of the lungs with areas of hemorrhage. The liver with multiple foci of necrosis. And this is maybe a little bit better, showing the liver, multiple foci of necrosis. And you can't differentiate that from some other infections, some pasteurellosis, for example, other types of Yersinia and tularemia. This is from a prairie dog, a focus of necrosis. Now let's continue our discussion of the gram-negative bacteria that cause septicemic disease. And we'll talk a little bit about pasteurellosis of ruminants. And this is caused by Pasteurella multocida and occasionally Pasteurella hemolytica. The hosts that we see this most commonly in are bighorn sheep and occasionally in elk. The distribution of outbreaks of pasteurellosis is in the western North America when we're talking particularly about the situation with bighorn sheep. The disease is epizootic, and we do feel that stress probably plays a role, at least in the pasteurellosis of elk, and likely to a degree in the situation that we see with bighorn sheep, septicemic pasteurellosis and also pneumonia. The disease can cause locally significant mortality, particularly in bighorn sheep, but oftentimes it is more of a sporadic thing that may kill a few animals, but it doesn't overall have an effect on the population. Transmission is by direct contact, and aerosol transmission is also important. Clinical signs, we get both a respiratory form, which is the most common. We're talking about bighorn sheep, where we have severe pneumonia in these animals with septicemia also occurring, but we can have pasteurellosis that's truly just septicemic, as we see in the elk on occasion. Clinical signs include respiratory distress, some depression, and oftentimes very acute mortality, with the animals showing virtually no clinical signs and are just found dead. The gross lesions oftentimes, particularly in bighorn sheep, include bronchopneumonia and pleuritis. Septicemia is generally quite obvious, and then in the septicemic condition in elk, hemorrhages do play a role, particularly on the serosal surfaces. Microscopically, fibrinopurulent bronchopneumonia is common, and again, evidence of septicemia with bacteria present in the blood vessels and sinusoids of lymphoid tissues, as well as in the liver. And then serositis can also be present in the thoracic and abdominal cavities. Diagnosis is by the appearance of the lesions, and then also bacteriology. These organisms are easy to grow in culture. And the circumstances. This is a bighorn sheep with pasteurlosis, and the animal's depressed, ears are down, and if we could see a little bit better, perhaps we'd see that there was a nasal exudate. The animal might cough as well. This is from a herd that was experiencing considerable stress due to environmental conditions, prolonged, very cold, -40 type temperatures with crusted snowpack, and the animals were under a great deal of stress and broke with pasteurlosis. Here we have a lung from a lamb with, or a bighorn sheep with pasteurlosis, and the typical bronchopneumonia here with the anterior ventral portions of the lung involved in the pneumonic process, and very frequently have a very sharp line of demarcation between the anterior ventral affected portions of the lung and the dorsal portions of the lung, which are oftentimes not severely affected. And once again, affected anterior ventral portions of the lung, sharp line of demarcation, and relatively normal appearing lung caudal to that. Microscopically, very typical fibrinopurulent bronchopneumonia, and various stages of from acute to more chronic appearance of the inflammatory infiltrate, and with the alveoli stuffed full of neutrophils in this case, and some fibrin, which looks like it's a little bit organizing in this particular case. And once again, congested blood vessels. The capillaries are congested, inflammatory cells, primarily neutrophils and some macrophages out in the alveolar spaces, edema fluid, some fibrin, and if you look closely, the pale blue areas of bacterial colonies. And appropriate kinds of staining, and we can see bacteria here. This is pasteurlosis. And then on the pleural surfaces, we can have a fibrinopurulent pleuritis, a lot of material organized here on the surface and actually can be pulled off in a layer. Underneath here we see vascular congestion in the lung. Another septicemic disease due to Pasteurella is avian cholera, so we'll talk about birds for a minute, Pasteurella multocida. The common hosts include a variety of wild birds that are affected by this bacterial infection, and the distribution of this is widespread. In terms of epizootiology, we do have epizootics that can be quite significant locally. Generally these occur in winter and spring, but occasionally they have been reported on some of the nesting grounds during the summertime in waterfowl. So while this is the more common pattern of epizootics seasonally in winter and spring, they can occur at other times of the year. There may be locally significant mortality in terms of thousands of birds dying in local areas. In terms of overall population effects to the free-flying birds, probably not significant. Transmission is by direct contact and by aerosol transmission of the bacteria. Clinical signs in this disease are peracute death. For the most part, these birds die very rapidly, can look clinically normal 1 minute, and maybe within 10 minutes can actually be showing significant signs and die. And so generally, as a wildlife biologist would see this, there would be large numbers of birds, say, on a pond or on a lake, and there would be a number of dead birds, but no sick birds that would be seen. If you do catch the clinical signs, frequently they're just depression. So there's nothing very diagnostic about the clinical picture. Gross lesions include hemorrhages on serosal surfaces, the epicardium, and on serosal surfaces elsewhere in the intestinal tract. We can see these hemorrhages. multifocal hepatic and splenic necrosis, which is a nonspecific gross change and can look like duck plague, and so that's one of the reasons, this is one of the rule-outs and considerations when we see splenic and hepatic necrosis. And there can be a mild catarrhal enteritis. We don't see the very severe ulcerative lesions that are characteristic of duck plague. Microscopic lesions, evidence of a septicemia, and then the inflammatory and necrotic lesions in the liver and the spleen. Diagnosis is based on examination, gross examination, and histopathology with the ability to culture Pasteurella from the tissues and absence of any evidence of a viral infection, including inclusion bodies or evidence of virus by electron microscopy. Once again, you can see nervous signs in some of these birds that have avian cholera, and in this case the bird, the pintail showing opisthotonus. Crows can also be involved, and this was a situation in Nebraska where both crows and other types of, and waterfowl were involved. So it isn't just ducks. This, unfortunately, is the way we get a lot of the carcasses, because frequently the carcasses are cleaned up very rapidly by scavengers in the area. However, you can make a diagnosis even off of a carcass in this kind of condition by taking swabs out of the marrow cavities of the long bones and, or out of the long bones, and actually the bacteria is fairly protected in that location. We can actually culture the organism if that's all we've got to work with. Lesions on the liver, the multifocal areas of necrosis, and on the heart you can see small epicardial hemorrhages. And note once again the birds are in good body condition. They have a lot of fat in the cardiac grooves, and you'll also see fat in the subcutaneous and visceral regions. And then microscopically, sometimes there are areas of necrosis that are very acute, and you have a little bit of necrosis here in the liver and large numbers of bacteria. And then a smear of the blood, or actually you can see it on histologic sections as well, the safety pin type appearance of the bacteria in the blood. This is a septicemic disease, and the bacteria are frequently very numerous in the blood. Another disease that's bacterial disease is infectious keratoconjunctivitis, primarily a bacterial disease, we believe. The etiology is not entirely clear. The variety of Moraxella bovis and ovis are cultured from eyes of some of these animals with infectious keratoconjunctivitis. Mycoplasmas have been thought to be important in some places. We haven't found that so much in the Western North America, but in some places in Europe it's potentially thought to be important. Chlamydia has been isolated from deer with keratoconjunctivitis. They may also play a role. We've seen keratoconjunctivitis associated with a pox virus in deer, and so there's probably, as in cattle and in sheep, a variety of organisms working in concert with environmental conditions to lead to keratoconjunctivitis. Distribution is fairly widespread, though. In talking to people working in the eastern part of North America, this doesn't seem to be very common in deer, where we see cases every year in Wyoming. Usually it's sporadic, but occasionally we do have outbreaks. Generally tends to involve males and tends to be occur in the fall and winter rather than in the summertime. And that may be biased just because that's when people maybe are out looking at a deer maybe a little bit more. There may be some local effects, and that was thought, at least in one outbreak in Utah, that there may have been some potential population effects locally. Transmission, probably direct contact. Mechanical vectors such as flies may be involved, but we don't have experimental evidence of that. But in looking at domestic species, we would expect that that might be possible. Clinical signs, clearly a keratoconjunctivitis. The animals do show the appropriate kinds of clinical signs that one would expect with severe inflammation of the conjunctiva and the cornea. Occasionally it may go to a situation where the animals do become blind. Generally it's transient, but in some cases it may be something that never does completely resolve. Those animals would become emaciated and could die either from the emaciation due to inability to feed, or increased susceptibility to predators, or potentially to trauma. An outbreak in Yellowstone National Park led to a number of animals dying when they fell off of cliffs. Gross lesions is very obvious and easy to diagnose. The keratoconjunctivitis is straightforward, again, maybe in poor body condition. And the lesions vary from acute keratoconjunctivitis if the animal is collected by the game warden, for example, to chronic situation if it doesn't heal and may die from other kinds of situations like accidents. Diagnosis is easy in terms of putting a morphologic diagnosis on it. In terms of putting an etiologic diagnosis on it can be quite difficult. Oftentimes the tissues are submitted in not the very best shape, oftentimes having been frozen. That limits the ability of culture to really pull out what the inciting agent was. These oftentimes are chronic and almost to an end stage, and so sometimes we just don't have the opportunity to clarify what may have been the initiating organism. But this is what we do see, a variety of clinical appearances in this animal, primarily conjunctivitis with a mucopurulent type exudate in the conjunctiva, and then the exudate coming on down the face, and this animal doesn't really have very much involvement of the cornea. This is a more acute case. This is an antelope fawn, and there actually is some pigmentation of the cornea and some infiltration into the stroma of the cornea by vessels. And a more severe case in this buck with very severe damage to the eyes, essentially an end-stage eye, involvement of the cornea as well as the conjunctiva, and this animal actually had a systemic actinomyces infection with abscesses in multiple places. More of an end-stage type of eye with ulceration deep ulceration of the cornea and scar tissue proliferation, infiltration of capillaries into the stroma of the cornea. And this, just to show there was some involvement of the eyes as well as the skin in this mule deer fawn with a pox virus infection, and that pox virus has not been characterized. Eyes taken from some bighorn sheep from Yellowstone Park, and this is the kind of sample I sometimes get where I don't have the remainder of the animal to work from, but eyes that have severe damage to the corneas with areas of pigmentation and severe scarring. And then histologically, a degree of thickening, loss of the covering epithelial layer, debris and inflammatory cells on the surface of the cornea. And then in this particular case, on electron microscopy, we were able to identify the presence of pox virus in the cornea. We do frequently get more axella, bovis, or ovis, depending on how you care to split the organisms out, and then chlamydia less often. But it is something that we see. Now I'm going to talk about some parasitic diseases that are important. For the most part, parasitic diseases tend not to be very important to populations. They're there. The animals live with parasites all the time, and they generally is a pretty good host-parasite relationship. However, there are a few examples where parasites can cause problems or where there's a potential for them causing very severe problems. This particular parasite is one that does have management implications for populations of wildlife, and this is Paralophus strongylus tenuis, and this is also called the brain worm or the meningeal worm, and it is carried by white-tailed deer, where it very seldom causes any degree of damage to the white-tailed deer. They're the definitive host, and there doesn't seem to be much of a problem. Good relationship between the host and the parasite here. However, when that parasite gets into abnormal hosts, which include moose in particular, caribou, elk, deer, pronghorn, a whole variety of other wild ruminants as well as domestic ruminants, this particular parasite can cause significant central nervous system disease. The parasite is normally distributed in eastern North America. As I mentioned, it's carried by white-tailed deer where it doesn't cause much of a problem, but occasionally can get into abnormal hosts where it does. There's no population effect to the white-tailed deer having this particular parasite, and there is a degree of controversy over the outcome of the potential for introduction of this particular parasite into populations of wild ruminants where it does not exist. In particular, out west, there's a considerable concern about potential for this parasite being introduced into naive populations of abnormal hosts. The transmission of this particular parasite, the intermediate hosts are terrestrial snails and slugs, and the parasite develops in those terrestrial slugs and snails where they're ingested by the abnormal or normal host, and then eventually through a series of migrations ends up in the central nervous system along the spinal cord on up into the meninges of covering the brain. In a normal host, there's no problem. In an abnormal host, the parasite continues to develop, and it migrates abnormally in the central nervous system, causing a lot of mechanical damage as well as inflammatory changes. The clinical signs are somewhat variable, but ataxia seems to be very common in affected animals, abnormal hosts now, and that may progress on to paralysis and torticollis. The animal may go down, and death may ensue following infection with actually very small numbers of parasites in abnormal hosts. The gross lesions may be variable. Occasionally there will be hemorrhages that you can see grossly in the central nervous system. Oftentimes there are no gross lesions. Microscopically, meningoencephalitis may be associated with the parasite. Sometimes you're lucky and you actually can cut sections of the parasite. Sometimes that doesn't happen. Malasic areas associated with the mechanical trauma due to the migration of the parasite can also be found. The diagnosis is based on finding the lesions and the particular parasite. In white-tailed deer, you can use a Behrman fecal analysis to find the larvae in the feces of the white-tailed deer. In abnormal hosts, the parasite generally does not complete its life cycle, with the exception of elk that have received very low numbers of parasites. Occasionally, an elk will actually survive infection and may become patent, though that's quite unusual. Distribution of this parasite is primarily in eastern North America, and it's within this red line here. The blue area is a closely related parasite, which is Paralophostrongylis andersoni, which is a muscle worm and doesn't really cause too much trouble. Normal host is white-tailed deer. The green is Paralophostrongylis oticolii, which is a muscle worm of mule deer, and again doesn't seem to cause too much trouble in its host. But we're concerned here is Paralophostrongylis tenuis, or the meningeal worm. It causes very severe disease, or it may cause severe disease in moose, and it actually a name for this disease the disease was recognized by biologists, and the disease was called moose sickness. And they are an abnormal host. The parasite migrates abnormally and ends up causing severe damage to the moose. This is an elk with P. tenuis infection, and you can see the torticollis, and the animal's been going in tight circles here. And that animal did not survive infection. This would be where the range of the white-tailed deer carrying this parasite overlaps with these other hosts. Mule deer can be severely affected. This is an experimentally infected mule deer, and you can see it's walking abnormally down on its hocks. The hocks are down, and the animal's ataxic. The worm is not very difficult to find as long as you look for it. This is the skull cap removed from a white-tailed deer, and the parasite is found here. They're fairly small. You need, like I said, you need to be looking for it. And the worm is on the surface of the brain. There's actually several worms in that picture. Need to be sure to differentiate them from the vessels. And again, the worm here on the cerebral meninges. And then migrating through the parenchyma of the spinal cord, sections of the nematode. And in this case, lack of inflammation, though in other cases you have very severe inflammation. In the central canal, and you can see the mononuclear infiltrates around the area where the parasite is, and then inflammatory exudate within the central canal. These parasites lay their eggs in blood vessels. The parasite eggs then are go through the bloodstream and are filtered out in the lungs, where they do cause a granulomatous inflammatory reaction. So these eggs and larvae are caught in capillaries of the lung, and surrounding them you do see a granulomatous infiltrate in the lungs. And in fact, sections of lungs sometimes can give you information on whether or not the particular white-tailed deer is infected, even if you don't do fecal analysis. Muscle worms, which generally don't cause overall much of a problem in their hosts, the mule deer or white-tailed deer, occasionally can cause hemorrhages in the muscle, which is a bit distasteful to some of the hunters when they cut in their meat. And as part of their life cycle, when they break, the larvae break out of capillaries in the lungs, they can cause petechial hemorrhages, and so this lung has petechial hemorrhages as well as some evidence of pulmonary edema. Also, this animal was quite heavily infected, and there were a lot of eggs and larvae trapped in the liver associated with a focal granulomatous infiltrate. In the mussels, the larvae and eggs can be trapped in capillaries occasionally, and you can also catch cross sections of the adult worms, and they may incite a localized mononuclear inflammatory reaction or granulomatous inflammatory reaction in the mussels. And again, these larvae, this is in an abnormal place. This happens to be the fat or in the mesentery, but these larvae will go ahead and develop even though it's a dead-end location, but occasionally you will find these on cross-sections of other organs. And then this is what the mussel worm looks like, and it's very difficult to find. You have to be very specifically looking for these worms or you never find them. They are characterized by a dorsal spine. Dorsal spine larvae characterize this particular group. You can't differentiate meningeal worm from the mussel worms by looking at the larvae, but on a Behrman examination, when the larvae are examined morphologically, this dorsal spine lets you know that you're dealing with parasites in this group, and there are some other parasites also in this group that are important. Say just a few words about lungworms because they are also important parasites of a variety of wild ruminants and other species as well. Probably the best known are the protostrongylid lungworms of bighorn sheep. This is lung from a bighorn sheep, and the thing to note here is in the dorsal diaphragmatic portions of the lung, this nodular type appearance to the lung. If you palpated that, you would feel nodules within the lungs. This is Protostrongylus stalzi, which seeks out this area of the lung and sometimes across the dorsal portion here to form lungworm nodules that are composed of the adult nematodes as well as eggs and larvae and the associated inflammatory reaction. Here you get a little bit closer view of these lungworm nodules, which are easy to palpate in the dorsal diaphragmatic portions of the lungs. There's another species, Protostrongylus rushi, in bighorn sheep, which lives in the airways. It doesn't tend to cause nodules, and you may see those when you're opening up the bronchi during the process of the gross examination, or you can occasionally see them on histology, but they don't seem to cause very much problem. There has traditionally been a lot of concern about Protostrongylus stalzi being the inciting factor for a lot of the pneumonias that occur in bighorn sheep herds, and I think right now the thoughts are that Pasteurellas are probably more important by far than the lungworms, because most of our populations of Rocky Mountain bighorns do have Protostrongylus stalzi, and there seems to be a pretty good relationship between the host and the parasite. This happens to be a lung from an elk, and we can see here that we have a dilated lobule there that isn't collapsed like the remainder of the lung, and this is caused by Dictyocollis parasites, lungworms in the airways and in the bronchi. Sometimes these can be quite numerous. They tend to be more common in the young animals, in the calves and the yearlings. They're pretty uncommon when you get on up into adult animals, and even though you may see large numbers of these parasites in the airways, they really don't seem to be too much of concern to the elk. And this is a deer with another protostrongylid lungworm in the airways. Again, occasionally you see these things that can be fairly dramatic in terms of the numbers that you see, but in terms of influence on the host, they really don't seem to be too important. Just a matter of actually seeing them. Now we go back just a little bit to Protostrongylus stalzi. That is rather than being truly in the airways, these worms tend to be down in the alveoli. The eggs and larvae or the eggs are laid in the alveoli. The inflammatory reaction surrounds those. The eggs hatch, and the larvae then also incite a considerable inflammatory reaction. They then migrate through the airways and up the trachea and go out in the feces. But sometimes when you're looking at lungs of bighorn sheep, you will find stray lungworm larvae in the ventral portions of the lung, sometimes associated with the mnemonic process and sometimes not. But oftentimes there is an inflammatory reaction around those parasites, but generally overall not considered to be too significant. This is a lungworm, a section through a lungworm nodule in a bighorn sheep with cross sections of the adults, and we've got eggs and developing eggs and maybe some larvae here, sections of larvae. So all the different stages present. Another parasite that can be locally important is Elaeophora. This is also called carotid artery worm or vessel worm. The clinical signs that are seen are somewhat variable. Traditionally, affected animals are said to have clear-eyed blindness, and that's due to the fact that the damage is present in the brain of these animals and the eyes look normal. Biologists frequently will say the animal is blind but has clear eyes. These animals do show nervous signs, and then they also may show other signs that are referable to ischemic necrosis of the extremities associated with thrombosis and damage to blood vessels. Occasionally we'll see buccal impaction, particularly in white-tailed deer that have Eleophora infections. Gross lesions, I'll show you some pictures of necrosis of the extremities on the ears, antler damage, occasionally hoof changes, muzzle changes, and then the buccal impaction, which occasionally occurs. That's nonspecific. We can see it due to other things too, but damage to the blood vessels supplying the face and the head of the animal can lead to this type of impaction. Microscopically, we can see areas of ischemic necrosis, and if we're lucky, sometimes we do see thrombosis, and then oftentimes we'll actually see the worms or cross-sections of the worms within the larger blood vessels, in particular the carotid arteries. And so when this is suspected, the carotid arteries are opened up throughout the length of the neck up into the head, and the worms are readily apparent if they're there because they're pretty good-sized worms. The diagnosis is by obviously the lesions that occur, and then microfilaria. These are filariid worms. Microfilaria will circulate, and those can be occasionally found, and particularly using skin biopsies of the skin of the head, because these microfilaria have a predilection for that particular area of the skin. The worm is Eleophora schneideri. It looks like I got this backwards. The common hosts include mule deer, which are the definitive hosts and are the common host, and generally the worm doesn't cause too much trouble in mule deer. White-tailed deer can be affected, particularly with the buccal impactions that I mentioned, and then elk is frequently where we see the clear-eyed blindness condition. The distribution is fairly scattered across the country, but it does occur in many parts of the United States, including the southeast and across the western United States. In terms of epizootiology, as I mentioned, the deer are the definitive host. Not too much trouble in deer, but in abnormal hosts we certainly can see clinical signs. The population effects really is not terribly well understood, though. This particular parasite has caused failure of transplantation of animals into, in particular transplantation of elk into areas where the parasite was common in mule deer, so it can have some management effects. And it is transmitted by biting flies, tabanid flies. There's an elk calf with Eleophorosis, and we've got the animal's blind, though of course you can't really see that in this picture, though the eyes look fairly normal. The animal's ears are necrotic, and this portion of the ears is drooped over and is essentially necrotic, and it's lost a good portion of its muzzle. I mentioned the buccal impaction, white-tailed deer, and very large impaction here in the cheek. And necrosis of the cerebral cortex, a large chunk of the cerebral cortex here is necrotic and gone. Very obviously a chronic condition. If in section we can see loss of portions of the cerebral cortex here and here. If we open up a vessel, in this case we can't actually see the worms, but we see villous proliferation of the endothelium along here. And again, this kind of a change you can see in mule deer. It doesn't seem to cause them too much trouble. In elk, though, the changes can be much more dramatic, and you can see fairly marked proliferation of the intima of these vessels. If you're lucky, you can catch the worm in cross-section, and it can be fairly dramatic, and again see the proliferation of the intima. And again, presence of the worms here in a vessel that's partially occluded by thrombosis, and then you can actually have complete thrombosis of the vessel and occlusion. Other parasites that may be important, scabies or mange, I guess. Various mites that are important in free-ranging wildlife include the Pseroptes mites and Sarcoptes mites. These parasites affect cervids. The Sauroptes get onto to elk and can cause problems there, and also in deer and on bighorn sheep. And then the wild canids in particular affected by the Sarcoptes as well. Distribution of these tends to be fairly widespread. In terms of epizootiology, it kind of depends upon the particular parasite and host. At least in our area, Sauroptes scabies is enzootic within our populations of elk. However, in our populations of fox and coyote, the disease is clearly epizootic, and we actually rarely see cases, but when we do, we have a number of cases. Population effects are probably minimal associated with Sauroptes, though in terms of local effects, the very large bulls seem to be the ones that are the most severely affected, and that catches a lot of public attention. There has been some modeling work done to suggest that scabies in coyote population and fox population may have overall effects in terms of decreasing population. So there is concern out of people that look at managing those fur bearers. Transmission, of course, is by direct contact between animals. Clinical signs, these animals look like what you would expect with scabies or mange. There tends to be a lot of hair loss, crusting of the skin. In severely affected cases, the animals may become emaciated. Frequently, these are seen during the winter time, and the animals have climatic conditions to deal with, and so they are put into a negative energy balance and may become emaciated rather rapidly. And various degrees of pruritus, though that doesn't seem to be a very common clinical sign. Grossly, again, as you might guess, obviously a dermatitis and occasionally, go back here, occasionally emaciation. Microscopically, of course, it'll depend upon the particular mite as to the kinds of lesions that you might see, whether the lesions are primarily on the surface or whether there actually is embedding of the mites into the epidermis. Usually it's a superficial paravascular dermatitis is the type of reaction that's seen. Diagnosis is usually pretty easy. Skin scrapings are easily done, and the mites are generally present in pretty large numbers. The identity of the mites can be somewhat difficult, particularly with the Sauroptes. There's a lot of, there's taxonomists that haven't entirely decided exactly what group these, or what species these parasites may fall into. Severe hair loss in a bull elk with obviously severe hair loss. This is during the middle of the winter in Jackson Hole when we have temperatures down to 35 to 40 below. And these animals obviously suffer considerable energy loss because of the loss of their insulating hair, and crusting and scaling on the skin surface. Presence of mites within this exudate, and we can have secondary bacterial infections. So this animal actually was really malodorous. It was really smelled terrible because of the secondary bacterial infection. Huge numbers of mites in that animal. Occasionally we can have mite infestation on antlers. This is a velvet antler with crusting and peeling of the velvet associated with the presence of mites. In bighorn sheep, the appearance oftentimes is not actually on the body, but within the ears, and here have crusting and scaling, and can have a tremendous buildup of material in these ears, and the animals can be functionally deaf due to scabies, which can be a real problem. This is a desert bighorn sheep with scabies, and in this case there was actually involvement of the whole body, which is a little bit unusual for Rocky Mountain bighorn, but does occasionally occur in the desert. And this was a very severe case, but also at the same time a number of other animals in this herd were similarly affected with severe loss of hair and crusting and scaling. You can see the thickness of the scaling on this animal's hide, and if you look very closely you might appreciate kind of a granular appearance, which is tremendous numbers of mites in that skin. Oftentimes with the Sauroptes you don't see very much in terms of inflammatory reaction. Histologically you can see some inflammatory reactions on the surface, maybe some microabscesses, and a variable kind of inflammation in the superficial dermis. And if you're lucky, you can occasionally catch the mites in action. And then this is the Sauroptes mite, and there are obviously important morphologic features that put it into the Sauroptes group. And then, as I mentioned, the taxonomists are discussing which things to measure and how to measure them to determine whether or not they're ovus or cervi or equi. So there's a discussion about the taxonomic relationships here. In the wild canids, this is wolf with scabies and or mange and considerable loss of the fur. Here, a red fox. Occasionally we have these come in, and this animal's lost almost all the fur off its tail, a little nubbin here on the end. And again, malodorous due to the exudation of fluids and that secondary bacterial infection in the thickened skin where he hasn't actually lost all his hair. This one's gone on to lose considerable hair with very little remaining hair. And actually the reaction is essentially caused the animal to be blind, with thickening of the skin and crusting over the eyelids. Very severe cases, and again, the thickening of the skin, loss of hair, and inflammation in the skin. The mites, of course, burrowing into the epidermis, serocellular crusting, and inflammation in the dermis. Again, skin scrapings will work to determine whether or not you have mites present. Okay, now we'll talk about just a couple of other parasites that I put in here for interest's sake, because they're things that you may see, but in general they don't have population impacts. First of all is Sarcocystis, and we're all familiar with protozoan parasite Sarcocystis. In wildlife, we basically can't find a wild ruminant that doesn't have Sarcocystis, but that doesn't seem to cause them any problem. And because the parasites are quite small in the wild ruminants, in the deer and the elk, hunters generally don't see them, and biologists don't see them, so it's of no concern. However, in ducks, the Sarcocystis species in ducks, Sarcocystis riley, is a pretty good sized parasite, and it's present in the breast muscles, which the hunters see and the biologists see, and occasionally can cause quite significant numbers of parasites, and it actually has a common name of rice breast, and people do ask about what this parasite is and does it cause any problem. This is a particularly heavy infection, but this certainly does happen. It's not that uncommon, and obviously people are concerned about that. Of course, it is just a Sarcocystis, and has a typical Sarcocystis-like appearance in the muscle, and again, it's really not of a public health kind of concern, but it certainly gets people concerned about it. Sarcocystis does cycle through the carnivore host, and here we can see the sporocysts within the intestinal tract of the carnivore host. So we can see that too if you have a particularly well-fixed intestinal tract. Leukocytozoan is a protozoan parasite that occurs in birds, and we do see this occasionally. Very rarely do I get decent blood smears coming through the diagnostic laboratory, but occasionally we do. This is from a red-tailed hawk, and in this particular situation there was a considerable mortality and loss of red-tailed hawks in Grand Teton National Park associated with black fly infestation, causing considerable disruption of the nests as well as transmission of this particular parasite. And in the dermal vessels of the skin, we can also see sections of the parasite here within the capillaries to be picked up, presumably then by the host. And then the megaloschizonts within the tissues of the bird. Again, the decomposed nature of the tissues is unfortunate, but that's commonly what we see in a wildlife situation. Leukocytozoan by itself probably doesn't cause all that much trouble, particularly in the raptors. Occasionally it has caused some problems in waterfowl, but it is a parasite that you will occasionally run across. Fascioloides magna is the giant liver fluke, and they live in the livers, so you can find these in white-tailed deer. These are pretty impressive trematodes. They are fairly limited in their distribution in that there's certainly some places where they're endemic and other places where you don't find them at all. Again, people look at these things and want to know what they are. They don't cause too much trouble in white-tailed deer, but obviously in some domestic species they can cause considerable economic loss and concern. Other parasites include tapeworms, and we generally don't think of cestodes causing very much problem in free-ranging wildlife, but we have had over the years some outbreaks involving fawns, both of fawn mule deer as well as fawn antelope, pronghorn antelope, where these animals, groups of young animals, tend to get very large exposures to Menesia and have very large parasite loads. These animals come in emaciated, generally in a very localized area, I might add, emaciated with tremendous diarrhea. No other evidence of parasites or no other evidence of infectious agents involved. Again, very severe diarrhea. This is a wild antelope, and obviously it's not normal that you can walk up and hold a wild antelope. And then when you open up the intestinal tract, they're literally packed full of these parasites. And in the absence of any other evidence for agents responsible for the severe diarrhea and the massive numbers of worms in some of these cases, we feel that, that probably it's clinically important in these localized situations. Cysticerci, larval tapeworms, we do see these in a number of different species of host, and this happens to be Pisciformis Tinea pisciformis in a rabbit, and you can see the little cysticerci, very typical cysticerci. Occasionally we see them in the abdominal cavity of wild ruminants, as well as deer measles in the meat, and these are brought in by hunters or biologists concerned about what these things may be. And this is Tinea cerealis in the muscles of a jackrabbit, I believe. So a variety of different types of larval tapeworms. This is Echinococcus, happens to be in a moose. Different cycles depending on the area where you are. Echinococcus multilocularis, Echinococcus granulosus, depending on the area. But these parasites do have sylvatic cycles as well as the domestic cycle with granulosis. Section of a liver showing hydatid cyst opened up, and you can see the hydatid sand, the larval tapeworm heads within the cyst. And Echinococcus multilocularis here in the liver, involving the liver of this animal. And then a squash preparation showing the multiple heads in the wall of these cysts. Ectoparasites, I already mentioned scabies, but ticks can be a problem. In particular, moose are highly susceptible to dermacenter albopictus infection or winter tick, and that occurs not only in the east where moose are present, but also out west. These moose seem to be highly susceptible to infection for whatever reason, and huge numbers of ticks can be found on these animals to the point where it actually probably does cause mortality of moose. It causes them to lose their hair, probably an energetic drain on the animals as the ticks take their blood meals. And so moose seem to be severely affected, whereas the other wild ruminants in the same areas don't seem to be as severely affected. This is a cross-section of or a lateral or sagittal section of the head of a deer, and I put this in to show you these pharyngeal bots, Cephanomia. And these are pretty common in deer. Again, hunters generally don't see them just by the way they dress their deer, but when they do find them, it can be quite alarming to them, and they want to know what these things are. It doesn't seem to cause much trouble to the deer, though occasionally I do see ulcerative pharyngitis associated with the attachment points and feeding areas of these larvae, and it would seem to be very aggravating to the deer, but actually it doesn't seem to cause them too much trouble. A little bit of comments about physical injuries that we see in wild animals, because it can be a problem, and probably the one that's the most important for people to know about is capture myopathy, and that is in a sense a disease that is frequently due to human interference. It can happen in the wild by the behavior of the animals, but it's called capture myopathy because it's most frequently seen following an episode of capture. When animals are captured. In acute cases, we can see hemorrhages in the between muscle fascia, and you can see even in the occasionally in the subcutaneous tissues areas of hemorrhage. That's actually not that common. More common are when you look into the muscles, you can actually see a paleness to the muscles. In the acute phase, the muscles may look fairly dry. As the disease progresses, the animals live a little bit longer. After the extreme exertional situation has occurred, it may actually go to the point of mineralization and even muscle rupture if the disease progresses. It's a disease that can be managed, and so people that are handling animals should be aware of this disease and should take appropriate precautions in terms of handling the animals correctly, making sure that the temperatures are as low as possible, because heat tends to exacerbate the situation and lead to more problems. This is a raccoon that was in a trap, and there are some traps that leg hole traps that tend to predispose to capture myopathy. And if we look here, these muscle bundles are quite pale in comparison to the muscle bundles on this side, and there are also some changes in the muscles of the shoulder as well. And microscopically acute capture myopathy can be present here. Very pale muscle in comparison to the remainder of the muscles. And then acute capture myopathy or acute exertional myopathy with necrosis of muscle fibers, occasionally some edema, fragmentation, loss of striations, these types of things in the muscles. If the disease progresses and the animal lives for a while longer, which they generally do, then inflammatory cells will come into the area of damage. Again, fairly acute capture myopathy here, exertional myopathy here, not very much in the way of inflammation, but a lot of acute muscular damage. With a PTAH stain, again, we can see some of the contraction areas and some evidence of swelling of the muscle fibers. And a case that's gone on a little bit longer with an infiltrate of macrophages, other mononuclear cells, cleaning up the debris, and occasionally you will see mineralization, though I don't believe there's mineralization in this particular section. Other kinds of physical trauma include electrocution and being out west where there's not very many places for birds to perch in many areas of the prairie. They end up perching on electrical wires, and we do see electrocution as a considerable cause of mortality in eagles, other raptors, and generally this is quite easy to diagnose. The bird feathers may smell like they're burned, and you can see the damage to the feathers oftentimes is very prominent. However, I've seen some cases where only a few feathers are actually burned, and it takes considerable examination of the carcass to find those feathers and to determine that the animal was in fact electrocuted. Generally, the history is very important here, though. Frequently, dealing with wildlife that's brought into the diagnostic lab, we frequently don't have a good history, and so sometimes the fact that it was found underneath power lines doesn't get put into the history. But obviously, just because they're found under power lines also doesn't mean that that's the cause of death, because we've had some malicious poisoning cases where the animals were dumped underneath power lines, and so that obviously got into the history in an attempt to lead the diagnosticians astray, and that can be a bit confusing. There's a trumpeter swan that was electrocuted. That's a little bit unusual. Generally, the problem that trumpeter swans have with power lines is not the electrocution part, but running into the wires, and that's a significant cause of mortality in some localized populations, particularly in the Jackson Hole area in Wyoming. But this animal has burned feathers here, and again, fairly obvious in this situation. Trauma, sandhill crane here that's crashed into power lines. These big birds, if the light conditions are wrong for them, when they're taking off or coming in for a landing and the power lines are in the wrong places, and frequently the power lines run alongside rivers or in areas where these birds are attracted, fields that they're going to, if the light's not good for them, sometimes they'll actually end up crashing into the power lines. And this sandhill crane was from Nebraska, in an area where a power line was causing considerable mortality of birds just from them flying from their roosting fields up and hitting into the wires, and caused quite a number of birds to be lost. Other kinds of trauma, sporadic kinds of things, a bighorn sheep falling off a cliff. You don't really think of that happening very often, but that certainly can occur. And in this case, the horn's broken and considerable hemorrhage down the side of the head. Predation is a major cause of mortality of a variety of our wild species, and that's a normal situation. This is a bighorn sheep that was killed by coyotes. They certainly kill wildlife as well as occasionally cause significant problems to the livestock industry in terms of sheep and calves. It's amazing how quickly these animals can be scavenged, and this animal probably was only killed several hours before the picture was taken. This is another aspect of wildlife work. It's not really wildlife disease, but I get asked to do this quite a bit. This is a domestic sheep, and I'm just showing the typical subcutaneous hemorrhage and puncture wounds that are associated with coyote kills. Generally, coyotes attack the animal from the ventral part of the neck, and I do end up looking at a number of animals, ruminants, that are killed by predators, and we have to make a determination as to what actually killed the animal. There's a black-footed ferret, and this black-footed ferret was killed by a coyote, and there are multiple bite wounds, but the killing blow was a puncture through the skull. Human-induced lesions in animals. This is, again, sporadic kinds of things that come in terms of physical trauma. Here's a foot from a coyote who'd been caught in a snare, and the animal was about a 2-year-old female. It was in excellent body condition, and had presumably been trapped about a year prior to this. The snare was almost completely through the bone of the foot, and the pads were quite swollen. As you can see here, the bones had actually come through the pads on this foot, but the animal was in good body condition. You can see here the snare is working its way through the foot. So various kinds of human-induced injuries. Biologists also induce their share of injuries. This is a prairie dog that was radio-collared, and the collar had induced a rub wound on the neck of this animal that had become invested with maggots and fly struck. So humans can cause lesions in these animals. A black-footed ferret with a collar wound here around the neck. Telemetry is really important in terms of following the animals around, but there may be a traumatic price to pay for the animals. And this is a grizzly bear that also had a radio collar on it. Of course, that makes it easy for the biologists to find them, so we do get to see these sometimes. This bear was quite an aged bear, and it had a collar on that had been on for a very long period of time, put on when it was younger. The bear had grown considerably, and the collar had worked its way into the tissues of the neck and almost grown over around one part of it, and it had caused a twisting of the or a deformity in the skull associated with a very tight collar, particularly on this side of the animal. And then darts. Biologists, again, do all kinds of things to animals, and this is a mountain lion bone with the end of a dart in the bone. And then forensic cases occasionally come through, again, looking at traumatic lesions. This was a grizzly bear that was shot multiple times, and these are bullet wounds, either